mntanami ngiyakumemeza nguma wakho namhlanje ngithi awukhulume mntanami uyamazi umuntu okudubula yalazi igama lakhe baba kaSenzo hlangana noSenzo umndeni wakameyiwa kaNomdaya kaSingile hlanganani namhlanje amaqiniso ahlala oba nesikhathele sidiniwe othi bedlala ngathi ngoba singenamali beneyimali ezinkulu imali ibhadile lapha ingane kaSenzo bayazi nokuthi ifunda ngani esikoleni bazozenza lezi mali bazoyenza le mali bayazi nokuyazi sikhathele vuka Senzo vuka mntanami ethuneni baba kaSenzo vukani nime nilwe ilwani manje isikhathi ukuthi nilwe mndeni wakameyiwa basingile baphingoshe vukani emathuneni vuka namba abantu badlala ngathi badlala ngathi ngoba singenamali beneyimali hayi kwanele manje lezinyembe sizikhalayo zincane nenjabulo sisazojabula mndenini wakameyiwa kwanele
Baba President mhlonishwa konke sekuphele iminyaka ewu4 yonke akwenzeki lutho baba ngiyacela baba ukuthi ungazi ungangisiza kanjani ukuthi bathulakale labantu inhliziyo yami ibhlungu ikhathazekile ngikhala every day every night ngicela baba ungisize baba Ramaphosa
ubhlungu obuzwayo ngiyakuzwela nami we feel for you, we are with you, and it's been too long actually for perpetrators of the heinous crime that was committed against your son are found, and the Minister of Police is focusing on this crime that was committed against your son as well. He is focusing on it because he wants it to be solved. And I have said to him, this crime needs to be followed through. We need to have this crime solved. And there are quite a number of other crimes, high-placed crimes, that also are on his desk. And he knows that he needs to work on those. And without telling you that, when will it happen, I want you not to lose hope. I want you to know that we feel for you, and our police are working on this crime, on this murder, and hopefully soon there will be some indications of what is happening. Because I agree with you, Baba Meyiwa, it's been just too long. And I know the pain that you feel, the heartache, and the tears that continue to be shed in the Meyiwa family. So we are with you and we are working on it.
View that Senzo was killed, and those people in the house know who killed Senzo. We're more than convinced. Personally, I'm more than convinced Kelly knows. I'm more than convinced that she knows something. And there must be a way she must be held accountable. But it must be done in an orderly manner so that its outcome is not questionable. Look, we hold a view, and a very strong view, that Senzo was killed. And those people in the house know who killed Senzo. We're more than convinced. Personally, I'm more than convinced Kelly knows. I'm more than convinced that she knows something. And there must be a way she must be held accountable. But it must be done in an orderly manner so that its outcome is not questionable.
Good morning, advocates. Good morning. Good morning, everybody. Good morning. K2 Medzi, good morning. Kuhle, good morning. Molweni. K2 Medzi, good morning. Zodwa, good morning. Duduzi, good morning. Yes, good morning, every one of you. Good morning. Sodwa, good morning. Tando Yenkosi, good morning. Jonathan, good morning. Good morning, guys. Good morning. Good morning. Conry, good morning. Bonnie, good morning. Huyemora, good morning. Good morning, advocates. Good morning. Morning, advocates. Let me write it. It's advocates. Temba, good morning. Musa, yes, Kelly Kumalo knows something about Senzo meyiwa's death. Must come and testify. Yes. She has to come by force. Vusi Zondo, good morning, guys. Good morning. Yeah, truly, Kelly must come. She must come. So good morning, advocates. Good morning, guys. Now this guy is bringing in the dentist, is bringing in some people to come in. I don't know, guys. I don't know if it is necessary for all these other guys to be coming in. Yesterday it was very short. We did not stream, but it was only 1 hour, 30 minutes. The session was very, very short yesterday. We did not stream yesterday. We don't know now how are they going to be doing it today, because we just want to see how they are going to do it today. Nonhlanhla, good morning. Yes, Ingani, hello, we want justice for our beloved Senzo. Definitely justice for meyiwa, definitely, guys. Skipani, I lost out yesterday. Hey, wait, it's like we are together there. I went through the session of yesterday. I was just checking it. It was 1 hour 30 minutes. They didn't do much yesterday. It was about this this guy who was called by Baloy, just to prove that these guys were not assaulted. That's what I only picked up, that they wanted to prove that these guys were not assaulted. That's the thing. They just put in something so that we are busy talking. That's it. Monges, how's it, bro? Ntombi, good morning. Yeah, today it's a dentist. The dentist is coming. The dentist is coming. Bona, there are many people who are going to be coming in who are not even necessary there, because Palo is just picking up some people to come in unnecessarily. So yeah, you can imagine, guys. You can imagine. Oh, the so-called doctor is coming. That so-called doctor is coming. Oh yes, I don't know. He's just. I think it's going to be the last because the trial in a trial is closing today. Today the trial in a trial is closing today. The trial in a trial is closing today. This is the last witness that is coming in, but now it's closing. But we did not get the documents which we wanted. Casper, good morning. So the documents that we wanted did not come actually, because remember, there were some documents, there was some paperwork that was needed, and they did not come. So you can imagine there are many things that we did not actually see coming through. Yesterday, I saw that the judge was actually connecting with the white guy that was there yesterday. He was actually happy. Like, I don't know. There's something fun about this judge of ours, guys. There's something fun about this judge. There's something which does not add up with this guy. I don't know what is his problem. I mean, I don't know. Jennifer, you are saying they must finish the case. The family is really aggrieved. They need closure. I agree with you there. I agree 100%. I agree with you. I agree with you there. I agree with you. Lindy, good morning, good morning, good morning. I hate these people. Good morning, good morning, good morning, good morning, Lindy. It's Monday. Not like I are saying, but we need Mjiako Kule trial within a trial. Exactly. This BS Mjiako is a lot of explaining to do. Exactly. Not like I agree with you 100%. I agree with you 100%. We need this guy Mjiako to come in. I don't know, but there's something that is not adding up with this issue, man. Really, there's something that is not right here. There's something that is not adding up. I don't know why. I don't know why it's like that, but there's something. It's not make sure. Kenneth, you're saying Osen Omnati Laboshlan morning advocate. Yes, wonderful morning. Morning advocate, morning advocate. Yandeka, sorry, darling. I was actually wait, month. You're saying where were you yesterday? Okay, I will explain in the inbox. Yeah, something just happened. Tandenkos, you're saying, I think as from Monday, the defense will be bringing their witnesses as the state finishes today. Yeah, but they are closing now. They are closing the trial within a trial. They are closing it. I don't know if the judge will allow that. I'm not sure. I'm not sure if the judge is going to allow that, because you know this judge is a bit yeah. I don't know. Let me not say much, but the judge, I mean, is doing some drama there. There's too much drama there. Yes. Advocate Temper. Good morning. Morning, guys. Doctor not arrived yet. I'm not sure. Maybe he's still parking his car or something. No. Remember, they say that sometimes the delay is being caused by the transportation of the guys from the prison cells coming to this site. So that's something that normally causes the other delay, because they normally say that their movement from that side coming this side. That's what they normally say. This one is saying, not actually saying the judge is a fan of Baloy and Kininja. Definitely. No, that one from the beginning we've been seeing that one. And it's painful, because we can't get we can't get exactly what we want, because there's too much bias here. It's like, yeah, I agree with you, Nontlantla. There's a lot happening. And even yesterday he was actually more of fighting this. He was fighting the defense team. You see, when the defense asks something, the judge becomes angry and he wants to correct them. But when it's Baloy, he does not even actually do anything. He doesn't do much. Tawanda, you are saying, I love how Advocate Mshololo is the knave. The judge's attitude on Advocate Mshololo is not make sure. I saw it. I saw that one. No, that one I saw it. Kolekele Charlie, good morning to you, Advocate. Good morning also. Good morning. So yeah, I saw that one. I saw he end up becoming, if you check, if Mshololo is talking, the guy end up quiet. Why can't they always figures are late? Yeah, I don't know why. There's a lot, like we said, there's a lot happening, guys. There's a lot happening there, and It's not good at all. Definitely, it's not. Yeesh, it's not good. Low Joe, more than a father. Who is that one now? Morning, my lovely advocates. Morning, morning. Jennifer, I think, yes, I noticed that he must shh, low. Yeah, because he becomes angry and I saw like you'll be just looking at Advocate Msholo like when she's talking, because when Advocate Msholo tries to say something, he actually he's not happy. He's not happy. I'm looking for that one. Where is this one? There's something that I wanted to. Okay, it's not make sure. Where is it? It's not make sure. I wanted that one. Where did I put it? There's something else. Bonisile, good morning. Refilo, you're saying, God, please expose lies today as we close trial within a trial. We trust in you. Today they are bringing the dentist. I'm sure another cooked up story is there. Nicole, good morning. So I don't know. There's something that that is going to be happening there. There's something that is going to be happening there. Yeah, something very interesting is going to take place today. Something very interesting. But I don't know, guys. What's your thought? What do you think about it? Lindelwa Mabunzana, good morning to you. Saying morning, my people, morning, everyone. Everyone that is here, Lindelwa is saying good morning. Bonisile is saying also good morning. Refilwe, you're saying God please. Okay. I saw that one. All right. Tandenkos, you're saying Jaco scammed Cronje. He produced somebody's certificate number to the magistrate. Cronje he was not an attorney by the time. Tanzi make confirm this, Patricia, the whistleblower, or confirmed by Patricia. Oh yeah, I'm trying to get hold of Patricia actually. I'll try to make sure I get her. I want to talk to her. Let me see. I would love to talk to her, and I want to hear something. I will definitely get in touch with her. I'll talk to her. I'll get her, and then I want to hear what is actually. I will just do an interview with her. I think Shololo will be the next victim by NPA. Who's it's true. Yo, you saw Baloy has been actually is being intimidated also. Remember, Baloy is being intimidated. They are now on his case. They are now on his case. They are traumatizing him big time. Yeah, I will try to look for, like I said, I'll try to look for Patricia. Let me see what did she put on a page today. Let's see what did she put on a page today. Yeah, because I normally check most of the things when she does post, because there is a lot that she normally gets information, deep information. I don't know where she gets this information. This one, she normally gets information. This one, I want to see what did she post today. All right. 32 minutes ago, she posted and she said apparently City Properties denied that they were the ones who pressed charges of trespassing against Advocate Tefo. So who is actually the complainant in this case? Tefo had been in detention since 1 August 2023 at Kosi Mampur. He had been arrested right after he pressed charges of defeating the ends of justice against Advocate Baloy, Gininda and Tere. Right. And she actually has the case number. Wow. You see, this lady is too much. Let me show you a site. Let me show you what I'm reading here. Let me show you quickly what I'm reading here. Yeah, this is interesting. This is a page. This is what I'm reading right now on a page. This is what she's talking about. Apparently, she's talking about this. This is what she's talking about. She's saying apparently the city. So she actually put in who is this one? Advocate Tefo. She's actually speaking about this Advocate Tefo because Advocate Tefo apparently he has been in detention since. Not like they're saying, guys, now it is clear who is being protected. Why every time Kelly's name come in the open, one of the defense team suffers a setback. It has been happening too many times. Now, is it because when Kelly is concerned, the real Mkulukud is up to no good? They pull the strings harder. I've seen that. Tokozan, you're saying, at first we thought Gininda was protecting Kelly. Now that Kelly has been mentioned, are we still saying Gininda is lying? If he is lying, then he is protecting who now? I think Tanzi and his friends are killers of Senzo, guys. Tokozan, we need more evidence to what you are saying. We need evidence to what you are saying. We need evidence. Morning, Lirato. Colloquially, you're saying definitely you will hear something like she stole a grandpa from Checkers. Yes, Piwe, good morning, good morning. I advocate, icon. Ababwe, guys, I don't know where these people are. Definitely, I don't know where they are. I was just reading this lady's Mjiako this, Mjiako that. Mjiako represented Tansi is lying, blah blah blah. Where are the defenders now? Please, let's gather here for a family meeting. Yo, Mjiako even submitted another attorney fidelity certificate number to the magistrate. Never challenge us to give you proof of your allegation. We will even add some extra spice. This is what do you call it? This is the page that this one is saying. This is the page she looks for news. When lions rub shoulders with pit bulls, Mngomezulu is us and we are Mngomezulu. The defense is ready to call their witness when the state concludes tomorrow. It's gonna be lit. Okay, they are ready to call the. All right, she was actually. You see, that's Advocate Mngomezulu's number there. It's going to be lit. They thought they are going to bury him. Instead, they've just watered a tree, right? So apparently, there's going to be something that is going to take place very soon because they want to call in. They want to call in a new witness. They want to call in new witness. Tanenkos, you're saying your thoughts are out, my brother. Try to regroup your thoughts. You will know the truth. Yes, Tanenkos, you are responding to what this one is saying. Tokozani, what Tokozani is saying. Tokozani, like what we said, we want to get our arguments with some facts. We want actually to get our arguments with some real facts because we need to know exactly what is happening. We really need to know exactly where we stand because apparently we can't just rule them out and say they are not right or something. I'm not sure. Dudu, they are saying Gininda didn't protect Kelly. Yes, he even applies for a warrant of arrest. Yes, the thing is this, guys, it's a game. It's a game. If he did not protect Kelly, why was she not called? You see, that's the only thing. People are saying they are after Mngomezulu. Now, as is injured. These dogs are on another mission. Tandenkos, you're saying your thoughts are out, my brother. Try to regroup. Okay, you are answering that one. Yet, non-Tanda is saying, I saw that one and the FFC Mjiako used. Powerful. Send it to me. I'll put the WhatsApp now so that you can send it to me. France, Good morning, advocate. Morning, advocate, subsequently. Mduduzi is saying Kininda is investigating Keshen is saying Kelly pays these guys. She's mastermind, but NPA refused to prosecute her. Remember, police only investigate and NPA has the power to bring to court. Okay. Now I get it. All right, now I get it. I get it. So you are saying that that is where the issue is. I didn't know about that part. So which means the NPA is being paid or what? What is happening with the NPA? Because there is something there. There's something there. Really. There's something there. So the NPA. Okay, now I get it. So the NPA is the one that is responsible for bringing people to court. I thought it was Baloi who is calling these people to come in. So why is the NPA wasting our time? Guys, we need to know what is the NPA doing, because now we are tired of this. We need to know what is the NPA doing in regards to this. We need to know what are they doing, because they can't just give us unnecessary witnesses to be coming to court. We need the real people to come there. Simpio, you're saying I can't wait for arguments. Not like you're saying the problem is that some people go to that live Waku TikTok and they come here with half information and hogwash information right all in that live without following the case. Exactly. People must follow the case, you see. Introduce, they're saying Kininda isn't protecting Kelly or anyone because he wanted to arrest Kelly and NPA refused. That's why he even write affidavit. Okay. No, I get you. That's why we are always right. So which means we need to find out what is happening at the NPA. Some people are saying the NPA is the biggest problem here. Who is actually heading the NPA? How is the setup with NPA? What is happening? If anyone can help, who's the boss of Gininda? Who is the boss of the cold case unit? Gininda was the one who was heading that unit, if I'm not mistaken. I stand to be corrected, but I think he was the one who was actually heading that department. I'm sure we can get something there. I'm sure we can get something there. Because we need to know what is taking place. Gloria, you're saying, what about the record trading? About the lady said she is a next door. I'm not sure. Is there something trending? I've not yet picked it up yet. Yes, we are live. We are waiting for the court to resume. I'm not seeing any movement at the court as of now. Let me see this. Oh, it's live. Oh, okay, sorry. It's live. Thank you very much. I'm busy doing some things here. Thank you for that. Thank you for that info. Thank you. Let me put you live, guys. I was busy doing something here. Yeah, I was
Manje bayibiza ngokuthi ke Dr. Sipho Makhatho kodwa ngaphambilini kwakuyi-Meyiwa.
And when did you obtain the degree Bachelor of Dental Surgery?
My completion was in 2019. I studied there for 5 years.
Ngagcina-ke noma iy'fundo zami ngayiphuthula-ke ngayo ku-2019 ngafunda khona lapho-ke iminyaka ewu-5.
And doctor, what does your experience entail?
In general, what we usually do, we are taught from the beginning to be able to, one of the general function is to be able to examine a person from the waist up, and also looking at, most importantly, our factor and most important thing that we focus on, it's the head and the oral cavity.
Thina-ke sakufundiswa-ke ukuthi-ke umuntu-ke masimbheka-ke simqale-ke lana-ke ezathi ukukhuphuka naye-ke sigqila-ke futhi-ke kwikhanda-ke kanye futhi-ke nakuwona-ke ngaphakathi emlonyeni kumazinyo.
Now, doctor, if you say you examine a person from the waist up, can you be more specific?
Specific, we look at the general appraisal. If the patient from the waist been hurt, we're looking at the inspection point of view, not proper examination from the eye view. We fully inspect the face, whereby we would put on gloves and then look at certain factors on the face. Would look at if there is any lacerations that has to do with the nose, the mouth, the oral cavity, and also the neck.
Sikwenzayo-ke ukuthi-ke sibheke nje sibukeke, ayi ukuthi-ke umuntu siyamxilonga, kodwa-ke sibheka lokhu esikwazi ukuthi singakubona ukusuka la ngaphezulu-ke ukukhuphuka-ke ebusweni, sifake ama-glove ethu simbheke-ke umuntu ebusweni ukuthi unayo yini imihuzuko anayo.
And then if we check the whole body from the waist up and we see anything that it's not within our scope, we are taught and instructed to refer these patients to certain disciplines so they can deal with those factors.
Uma siqeqeshwa-ke noma sifundiswa-ke ukuthi uma umuntu simbuka simbheka-ke sibese siyabona-ke ukuthi khona-ke la engahambi kahle noma khona ukulimala khona. Uma siqeqeshwa-ke noma sifundiswa-ke ukuthi thina-ke bese kufanele manje simdlulisele-ke mhlampe asithi-ke kudokotela ofanele okuyena-ke ozombheka.
And which disciplines will that be?
The disciplines, mostly if there is severe injuries to the face, maybe we have jaw broken, maybe the patient appears to have some step defect, the face doesn't look properly the way which it looks like it's a bit deformed, we send it to a maxillofacial. If it's has to do with the torso and the hands, and we see maybe there's something really wrong, we refer to a medical officer, in layman's term a general practitioner, which is a doctor, and then they take over from there.
Kuya ngokuthi-ke ikuphi la esibona khona-ke ukuthi-ke akuhambi kahle uba ubuso kula emzimbeni-ke ilana-ke sibona ukuthi ayi cha lana-ke akukho ngendlela bekufanele ukuthi kungayo, bese siyamdlulisela-ke kudokotela-ke osebenza ngako kona lokho.
Can you put your work experience on record?
I did my ComServe from 2020 until 2021 January in Tlhabane, a community health center district. That was my ComServe. And then from 2021 and onwards until present, I have been in private practice, which entitles that I have my own establishments that I run, and then I still work there and practice as a dentist.
Ukusuka noma-ke umsebenzi wami-ke ngo-2021 ngo-2020 kuyoshaya-ke u-2021 ngisebenzile-ke eTlhabane la engenze khona-ke abakubiza ngokuthi-ke i-ComServe. Ukusuka ngaye-ke u-2021 kuze kube manje-ke ngiyisebenzela-ke mina-ke, kodwa-ke ngiyisebenzela nginjalo, kodwa-ke nesikhathi-ke la engihamba ngiyosebenza khona ngale futhi.
Dr. No, ComServe might be common parlance in the medical fraternity, but in layman's terms, what is ComServe?
In layman terms, we, in our medical study area, we study within, after 2 years, we're already starting to do our clinicals. We see patients, real patients in normal settings, where we see them under supervisions of our superiors. And then after completing those years, after the 5 years, we have to serve the state. Every
Okay. Okwenzekayo-ke noma uma ngichaza-ke lokho ukuthi-ke nkathi sisafunda-ke kwiminyaka emibili-ke ila esinikezwa khona-ke ithuba lokuthi-ke manje siyeke noma siwaboneke ama-patients, kodwa asizenzeli-ke lokho. Bakhona-ke abangaphezulu kuthini noma abasiphethe ekuyibona-ke ababheka-ke noma ababuka umsebenzi wethu esiwenzayo-ke, bese kuthi manje-ke uma sesiphela-ke noma-ke iminyaka emihlanu lena sesiyiqedile after 5 years.
So in brief, ComServe is community service.
Yes.
ComServe lona-ke ukuthi-ke siyosebenza emphakathini noma senza umsebenzi khona-ke emphakathini.
And if you say you've got your own establishment, you refer to the fact that you are in private practice.
Yes.
Ukuthi-ke mangikhuluma-ke ngokuthi-ke manje ne-practice yami ukuthi-ke ngiyisebenzela ngiyimele.
I just want to show you a document which has been marked exhibit VV in brackets 1. Do you recognize that document?
Yes, I do recognize it. It's a form that we use in the Northwest District for examining any patient that we see in the dental department. It's the standard form that we use as dentists. We go through it with the patient. We have questionnaires, and then we have our own examination of the patient.
Lana-ke le phepha-ke noma-ke le document ephambi kwami-ke iyona-ke esiyisebenzisayo e-Northwest uma-ke sihlangana-ke noma sibheke-ke i-patient la khona-ke thina siyibukela noma siyibhekela lokho esikubonayo kanye futhi sixoxisane sikhulumisane nayo i-patient.
If I can ask you to turn to page 3 of exhibit VV in brackets 1. Yes, there's a place that is reserved for a signature, and there's a signature there. Whose signature is that?
That's my signature.
Kule page yesithathu-ke ongibuza ngayo la ongibuza khona-ke ukuthi ubani wasayinda laphayana yimina wasayinda.
Thank you. If I can ask you to go back to page 1. Can I ask you, doctor, to read the contents of exhibit VV in brackets 1 in the report? And if you can do so slowly, giving the interpreter a chance to interpret and explaining all the medical terminology.
So from the top of the page that we have, it starts with the stem for the health department of Northwest Province, Republic of South Africa. So it then states that it's Tlhabane CHC, which is Tlhabane Central Health Community Center. So it says dental services. So the form starts off by patient's name, as we're saying, it's Bongane Sandiso Tangi, and then it has the patient's age, and then we also indicate the patient's gender, that it's a male. The patient's age, it's 29 years old at the time of the examination. So we also go on to allow the patient to give us the next of kin information, which is in this one, the patient stated it's Ulebugile Petani, which was a partner, and then they also give us the cell phone numbers, and there's also an address, which says it's 3125 Freedom Park, phase 2, and then the patient's age, which in this, it was indicated that the patient was born in 1990 in December the 2nd.
Lana-ke the form lena-ke uma siqala phezulu-ke yila inestamp khona-ke somnyango-ke wezempilo wase-Northwest, iyachaza-ke futhi Tlhabane CHC ukuthi-ke kusemtholampilo wase-Tlhabane, futhi-ke noma-ke kuhlangothi elisebenza ngamazinyo, futhi-ke ichaza-ke igama laphayana le patient Bongani Sandiso Ndangi, noma ngendlela ebhale ngayo la Umtanzi, Umtanzi iminyaka yakhe 29, ukuthi umuntu wesilisa, ukuthi-ke lowo-ke ahlobene naye-ke Ulebugile Petang, oyipartner yakhe, inamba yakhe, nokuthi uhlala kuphi, 3125 Freedom Park, kanye futhi nokuthi-ke ulimi lasekhaya isiZulu.
Yes, home language.
And then from there on, we also ask the patient's occupation, whether the patient is employed or whatsoever. In this case, when we got into contact with the patient was currently a prisoner, because we need to state whether it's a prisoner, it's a pensioner, or it's an unemployed law-abiding citizen, those things, and then we state that. And then from there, we get to the main complaint, the main reason why the patient is within our facilities.
Yeah, just a minute, doctor. Sorry.
No, you can finish.
Yes, okay. Yeah, doctor, if I might interrupt you, you mentioned that he was a prisoner. Do you perhaps have an independent recollection of this patient?
Given the location where the Tlhabane district is, it was rare for us to encounter prisoners. So in my time working there, I would say for that whole year, he was the only person that's a prisoner that I saw that day.
Lana ke bese yaqhubeka ke nokuthi ichazeke ukuthi ke mhlambe umuntu lona ngoba sifanele sibhale ke sisho ukuthi usebenza kuphi noma ke uhola impesheni lana ke kubhaliwe ukuthi isiboshwa usiyabuza kumshushisi ukuthi into oyikhumbulelayo leyo ukuthi ke wayisiboshwa kwindawo ke esikuyona noma sisebenzela kuyona eTlhabane kwangavamisileke ukuthi sitholeke iziboshwa kulo yanyaka ke engangisebenza lapha kwakuyisona uyena kuphela oyisiboshwa noma isiboshwa sokuqala engahlangana naso kulo yanyaka.
And doctor, do you remember whether he came on his own, whether he was escorted?
My recollection, the patient was escorted. I remember seeing, I can't remember the number of the wardeners, but I remember there was a police cop and also a prison warden. And I remember there were some handcuffs on the patients when they came in.
Engikhumbulayo ukuthi wayengayihambeli yedwa ke wayephelekezelwa ke lakhona iphoyisa kanye futhi ke nasojele nabo bekhona ke futhi ke efakwe nozankosi.
And if you can explain, doctor, as to where the examination took place and where the people were who escorted him?
Usually in any case and scenario, when we take an examination in a dental room, if it's a minor, we allow the parent to get in with the patient. If it's a partner, we ask the patient if they feel comfortable to having their partner within the examination room. But the only time that we only have with the patient, it's supposed to be me, the operator, and also my assistant, and also the admin people for the fast. But the moment we start seeing the patient, it's only going to be me and the assistant, and then we assess the patient. And in this case in point, we were given space, I would say, because the wardeners and the policemen, they went outside, they kept the door a little bit open. They told us, or if we have any issues that we're having, we should quickly run to the door, because in any protocol, a state prisoner is not supposed to be left alone with an outside citizen without guard.
Okwenzekayo ke lana ngoba umbuzo ubuthi ke lana ke ngathi ke noma kwakuphi la owawu umbhekela khona ke futhi ke laba ababemphelelezele babe khona yini ngokwenjalo ke uma kuukuthi ke umuntu osemncane ke ngomunye iminyaka noma ingane kuye kuvunyelwe ke ukuthi ke umzali abe khona ngaphakathi noma ukuthi umuntu futhi uhamba naloyo ke noma ke unkosikazi noma umyeni wakhe ke acabuzwe ke yena ukuthi uyafuna yini noma uyamvumela yini ukuthi abe khona ke kodwa ke lana kuba yimina naloyo ongilekelelayo kodwa ke la kule yona ke okwenzeka ukuthi laba ababempelekezele amaphoyisa nawusejele baphuma baya ngaphandle kodwa isicapha lesi ke basivula kancane base bengitshela ke ukuthi uma kuukuthi khona ke inkinga ekhona kuzofanele ngibalekele kusona ke isicapha ngoba ke akuvumelekile ke uma kuukuthi umuntu uyisiboshwa noma ungaphansi kombuso ashiwe eyedwa engabhekiwe.
Yes, we continue, doctor. Main complaint?
So main complaint, usually when a patient arrives, we ask them, why are they there? What's the main reason why they are there? So in this situation, the police corp is the one that indicated that the patient came for an oral examination. They want us to examine the patient per se, according to our standard, the way in which we examine patient.
Lana ke masesitshelwa ke ukuthi kwangani ke ukuthi ke lapho ke umliso leyo ngatshelwa ke iphoyisa ke ukuthi ke we patient leyo ke yayinesifiso noma ifuna ke ukuthi ke ibhekwe noma ke ihlolwe ke la emlonyeni.
So I continued further. I remember continued further asking the policeman, or is there anything specific that I'm supposed to look out for so that I can rule it off or indicated in the situation. I remember the policeman spoke about if I should check if the patient had any sort of gold tooth inside their mouth. So that's where I basically started, but I treated the exam as standard. And then that's when I started with checking the dental history of the patient. Usually ask the patient if they've had any dental work done, whether they removed a tooth, whether they have a false tooth inside. The patient did state that they only removed teeth down the years. They pointed out the spots, and then from our knowledge, I was able to indicate which type of tooth that were removed there. So in that case, there were 3 teeth that were removed, and 2 were in the third quadrant, and the other one.
Yeah, just a minute.
Lana okwenzeka-ke ukuthi-ke iphoyisa-ke lasichazela-ke noma ngabuza-ke mina ukuthi yini kahle kahle lena ekufanele ngiyenze noma ekufanele ukuthi ngiyibheke-ke asho-ke ukuthi-ke kukhona-ke izinyo kwakufanele ukuthi likhishwe kwakuyizinyo-ke legolide. Ngase ngikhuluma naye-ke futhi ngibuza-ke ukuthi ngaphambilini usuke wawakhipha yini amazinyo. Ushilo-ke ukuthi akhona-ke amazinyo amathathu aseke wawakhipha. Yila nginako khona-ke ukuthi ngisho-ke ukuthi yiphi inhlobo yamazinyo eseke yakhishwa ngaphambilini.
Doctor, can you explain the term quadrant?
Quadrant, we're speaking to the sides in which the teeth are located. In general, the way in which we chart and then we label the teeth, we label them in numbers, but the numbers take part in 4 quadrants. We have the first quadrant, which we call the first quadrant, whereby we start by every tooth it's labeled as its number. The quadrant is divided. We start from the middle of the head, we divide it into 2, and then we divide the jaw, the lower, the mandibular jaw, and the upper jaw. So we divide it to 4 segments. So we do it in a C format from the point of view of an individual. So we'd say we start on the first quadrant. It's supposed to be, the first quadrant will be on the right. We go on the left as we go down to the third, and then we go to the 4th quadrant.
Lana-ke ila amazinyo-ke ahlukaniswa khona-ke uma sewabizwa-ke ngama-quadrant-ke owokuqala, eyesibili, eyesithathu noma eyesine. Uzothi-ke eyokuqala-ke uhlangothi la ngokwesokudla, bese siya-ke ngokwesokunxele siyehla-ke siyenzansi, bese siya-ke kulo esithi-ke uhlangothi lwesine-ke noma-ke quadrant yona-ke ezophinda izobe ngesezansi uhlangothi la ngakwesokudla. Indlela leyo esihamba ngayo noma esenza ngayo uma sesibheka-ke amazinyo lawo.
You explained that there was extraction in the third quadrant. Yes. Can you mention the numbers?
The extractions that were done in the third quadrant, it was the 3-7 and the 3-5, and then we also have extractions on the 4th quadrant, which was the 4-4.
Okay. Can you explain the 3-7 and the 3-5?
The 3-7 and the 3-5, it's the teeth that are in the 4th quadrant, meaning it's the teeth that are sitting at the back partially, which we have at the back, we have the molars. So in different, what we're saying, the patient had an extraction of a molar and a premolar that was done on the 3rd quadrant.
Lana-ke esichaza noma esikushoyo-ke ukuthi la mazinyo-ke ayekhishiwe-ke kwabo la mazinyo-ke la uwathola engasemuva-ke emlonyeni womuntu.
And then also on the 4th quadrant, there was one which is a 4-4, which is also a premolar that was removed, which is on the 4th quadrant, which is on the right lower side.
Kanye futhi-ke nelilodwa-ke uhlangothi la ngakwesokudla la ngezansi elalikhishiwe.
Just in simple terms, what is a molar and what is a premolar?
A molar, in layman terms, we have front teeth. The front teeth that we see when a person's smiling, we call them incisors. So incisors are the ones that when you enter food into your mouth, if you're going to chew something, you cut them with the front teeth. The ones at the back, we call them molars because usually in a way they mold the teeth. They have a larger surface area compared to the incisors. The premolars have a medium surface compared to it has a medium surface compared to the molars and also the incisors. So they are the middle teeth when we are starting from counting them from number 1 until the 8th tooth.
The middle ones, the molars or the premolars?
The middle ones are the premolars.
Lana-ke la athi akhishwa-ke uthe uwachaza-ke athi ama-molars yila angasemuva-ke wona bese kuthi kunala mazinyo-ke ala ngaphambilini-ke uma umuntu mhlambe-ke esimala noma ehleka-ke ekuwona owabonayo yila bathi uma bewabiza-ke bona-ke odokotela bamazinyo ama-incisor. Bese kuthi kuba nala aphakathi nendawo uma bewachaza-ke bawachaza ngokuthi-ke wona-ke ama-premolar.
Yes, may continue on the form.
So from the form, because that's what's the dental history that we ask the patient. So I need to brief on how we label those depending on what we already have. So when we look at there, we go to the health questionnaire, whereby as a general healthcare professional, any healthcare professional, whether you are a physio, whether you are a audiologist, whether you are a dentist, whether you are just a normal doctor, even a nurse, when they examine a patient, they need to ask certain questions to find out by the disease status of the patient if it's going to implement in any sort of treatment that we're going to have.
Lana ke okwenzekayo kunemibuzo ke ekufanele ukuthi noma uyiphi inhlobo kadokotela noma usebenza ngani ke noma usungumhlengikazi ke kunemibuzo ekufanele ukuthi uyibuzeke ngaphambilini kokuthi ungaqala usebenzeke ngayo i-patient.
It's correct. It's basically the history of the patient.
From the patient's point of view, them giving us their history from asking.
Mlando ke lo esithola kuyena ke lo muntu ozobona ke udokotela ngokuthi kube uyena ositshelayo ngaye.
Yes.
So the questionnaire goes, it's a number of diseases. So these diseases are the ones that are usually gathered through. They are the diseases that we usually use as a standard to check whether it's going to interfere in any sort of treatment due to the material that we're going to use. If there is any material that the patient has an allergy for, when we study initially, we check the allergies. So we check if the patient has any allergies. They state whether they have yes or no. If they have allergies, we need to state it out if there's there. In this case, the patient didn't have any allergies as stated by them.
Okokuqala ke ukuya ngokuthi ke yini ke ezoyisebenzisa ke uma sesiqala ke ngomsebenzi ukuthi ke kulezo esizoyisebenzisa khona yini ezingamphathi kahle noma la athola khona ke ama allergy ila esithi siqale ngakhona ke noma umbuzo oqala khona ke nangokusho kwakhe ukuthi you said the answer impendulo kwaba ucha ayikho.
Yes.
And then we go on to the heart. If they have any heart disease, then we want to find out whether the patient has any heart, which means or any chronic disease that's related to the cardiovascular, which is, it's written here, it says heart disease. So in this case, the patient said yes. And then we went further on to ask, what do they mean when they say they have a heart disease? They spoke that back in 2014, they had a mining accident whereby they told them or they have some minor heart disease that they stated to us. And the patient couldn't elaborate further on that. And they said they're not taking any medication for that. So we just noted it down because it's something that we need to take into consideration if we're going to treat the patient.
Lana ngokumayelana ke noma ke okulandelayo ke awasitshela kona ke uma ebuzwa ke ukuthi khona yini ke okumhluphayo ke ngenhliziyo wabe sephendula ke ethi yebo ngase ngifuna ukwazi ke ukuthi usho ukuthini uma esho kanjalo washo ke ukuthi ngo2014 khona ke nje ingozi nje encane ke eyenzeka ke ngokumayela nayo ke inhliziyo nokusho ke futhi ukuthi ke ayikho imithi ke noma medication ayithatha futhi ke akazange futhi afune ukuthi ajuleke bese yachaza ukuthi yini noma kwenzekani kahle kahle.
So we also ask if the patient has any venereal disease, which is just involve the outside appearance of how they their veins and their vascular system kind of works. So the patient said from their knowledge it's no. And also we also went on to ask the patient about their HIV status, if they know whether they are positive or they are not. The patient said they are not aware of that. So they didn't want to conclude it, so we read it as no.
Okay. Apologies, Madam. Can you just repeat this one? The venereal?
The venereal disease, we're checking the vascular system. If they have any problems with the vascular system, meaning if they have any diseases that involve the veins, maybe they have vascular thrombosis of the legs or one of those things that they have clotting factors and problems.
Lana ke uma bese ngimbuza ke kuloko okubhaliwe ukuthi venereal yona ke iphathelene nendlela ke yokuhamba noma yokusebenza ke kwegazi noma ukuthi ke mhlambe ikhona ke lana einyaweni umuntu anenkinga nako wasiphendula ke ethi cha buzile futhi ke mayela nesimo sakhe ke ngokumayelana ke noma ngokuphathelene ke nayo ke ingculaza i-HIV wabe esitho ke ethi yena ke cha akazi noma akanaso ke isiqiniseko salokho ingakho ke ngibhalile lana ngabhala no.
And what, doctor, what would the thrombosis of the leg be?
Most cases it's just systematic diseases, meaning or it's a disease that maybe an individual has due to inheritance or due to, which is they're close together. In the exam, the heart and the venereal disease are close together because if you have a heart problem, it might lead to varicose veins, which means there's blockage in the veins and whatsoever. Those are systematic diseases that any individual can have due to heredity or maybe due to certain factors like maybe being overweight and those things that's systematic.
Lana ke engikhuluma ngako mase ngikhuluma ke mhlambe ke ngokugula ke mhlambe ngokuphathwa inyawo ke khuluma mhlambe asithi nje igazi ke alihambi kahle ke nokuthi mhlambe ke ugula lokho owakuthola ke komunye womndeni ugula nje okudluliselwe omunye womndeni ngikhuluma nje ngento ezifana nalezo.
Yes.
And then when we continue, we ask if they have any lung diseases. Usually for lung disease, we just check if the patient knows if they have any problems with their lungs, whether they can't breathe well, or maybe they know they have TB or any other disease, which TB is tuberculosis. So the patients say they don't have that. They say they don't have that and they don't know any knowledge of having that.
Bese kuthi futhi ke ugula ke okuphathelene nazo ke iphunga nokuthi ke mhlawumbe umbuzeke ukuthi mhlawumbe uyazi ukuthi unayo yini iTB lokubuza ukuthi i-tuberculosis abesithi cha ke nokuthi futhi ke akanalo nje ulwazi lokuthi ke lwakho khona lokho.
So, and also we went on to check if also another thing that you check if they have any problems with the bleeding because it affects the treatment. If the patient bleeds too much or they have a bleeding disorder, which in most cases it's, we look for like hemophilia, which is the inability of the body, red blood cells to clot and creating a clot to stop bleeding. So we checked with that, the patient says well, they don't remember having any of bleeding problems in regards to that, and we ask if they are on any medication, and as they stated, they said they were not on any medication, and then we went to their smoking as well. They said they don't smoke.
Lana ke mase kuphathelene nesimo ke mayelana ke negazi ke nokuthi mhlawumbe khona nje inkinga nayo nokuthi ke uphuma igazi kakhulu ke ngoba nalokho ke kuzoba nomthelela onako ke kumsebenzi esizowenza wabesesho ke ukuthi ke cha akanakho lokho. And then yila esesindlulele khona ke ekunokuthi kumbuzeni ke ukuthi mhlambe ingabe uyabhema yini.
And then we went on further on to ask about rheumatic fever. Rheumatic fever, it's a heart problem which leads to infections of the heart valves, which leads to the body not functioning well. And the patient said the only heart problem they say they remember is the minor heart condition they had, and there was never stated to them what was actually the actual condition. So in this case, we said no, and then we went on to check the cosmetic disturbance, to check whether the patient is in full mindset, whether the patient looks a bit disabled mentally. Those ones we usually ask the patient if they have ever been in a psychiatric hospital. Those instances, if they do have ever been admitted to any psych hospital for not being in the right state of mind due to depression or any of that, the patient said no.
Lana ke uma sesifuma ngayo ke rheumatic fever ke ukubheka ke isimo sezomzimba ukuthi ke indlela umuntu azizwa ngayo nokuthi khona yini ke ungaphathi kahle lapho abesephendula ke ethi cha. Kubhekwa nasibheka futhi ke nesimo ke somqondo ke ukuthi mhlambe akukho yini ukuphazamiseka okukhona ukuthi mhlambe umuntu lona wayeke waya yini kwisibhedlela la ekubhekwa khona ke abantu ukuthi ke mhlambe akukho yini ukuphazamiseka noma ke ukugula ngengqondo anako nalapho impendulo yathi cha.
And then generally we ask, it's here in the questionnaire whether the patient is pregnant or not. Because it's a man, obviously we take no. A man can be pregnant. And then we also have the viral infections. In regards to the viral infection, we look for other viral diseases. We're talking about herpes simplex, which is in normal terms, things like chicken pox and other the viral diseases, a range of them. So we explained to the patient what kind of viral diseases there are. So the patient said they don't have any viral disease that they could remember of.
Olandelayo ke ukubuka ke isimo sakhe ke ukuthi ke uyithwele yini ke ngeke ke umuntu wesilisa ayithwaleke ila esesibhala khona ke sithi cha bese kubuzwa ke olandelayo ke ama infections ke la chaza khona okufana noma chicken pox wabe esephendula-ke cha akanako lokho.
And then we all went on to check, ask the patient if they have any epilepsy. Epilepsy, most people in common terms, is fits, where the patient tend to get into fits randomly due to triggers, maybe flashing lights and other things. So the patient said they don't remember having any sort of fits. So, and then we also went to ask if they have diabetes, which is in common layman's terms, it's called, they call it sugar diabetes. So, which is they have any problems with the glucose level in regards to that. The patient, they said no. And then we also have if they have any kidney problems, and then we explained to the patient what kidney problems is. The patient said they don't remember having that, and also with high blood as well. And the patient said they don't have any high blood and they are not taking any high blood medication.
Bese kulandelayo ke ukubheka ke manje ke lokho kubizwa ngokuthi ke amafithi ke ukuthi unawo yini, waphendula ke ethi cha. Ushukela noma isifo sikashukela, ugula ngoshukela, uphendula wathi cha. Inkinga yini ngeinso zakhe noma ke ama-kidney akhe, nalapho uphendula wathi cha. I-high blood washo ke ukuthi nayo ke akanayo.
And then we go on to ask if the patient has ulcers. Ulcers, it's normally common in people. They would say, in common terms, it could be a stomach ulcer. It could be the ulcer that's there on the trachea system, or the ulcers could be inside the mouth, which could be triggered by certain factors. Some people will complain maybe tomato. Some would say maybe when they eat spicy things and whatsoever. So we checked in regards to that, because it also impacts the type of medication we're supposed to prescribe for the patient if they have any sort of pain or infection. So we checked that, and the patient said they don't remember having any sort of that.
Base sidlulela ke kuma-ulcer ila lokho khona-ke kwenziwa-ke kuya ngokuthi omunye ke uzothi uma ngidle utamatisi ke, omunye athi uma ngidle ukudla okushisayo ke. Siyabheka ke naloko, noma ngoba kufanele sazi ke ukuthi ke yini ke medication ekuzofanele umuntu simnikeze yona ke, waphendula ke wathi cha akanayo inkinga yalokho.
And then we also further investigate if the patient has any other disease. The patient will have to state to us if they do have, and if they say they are, the patient in this case that we didn't mark no, because the patient said they are not sure if they have any other disease. So they were not certain about that. We didn't mark no. And also we checked if the patient has ever undergone any sort of operation. Could be leg, could be head, could be stomach, any sort of operation. The patient also stated no. And then we asked them if they're taking any recreational drugs. We're talking about alcohol, could be cocaine, could be heroin, any sort of drug, or even yawa. But the patient said they don't.
Lana ke okulandelayo ke bese simbuza ke umbheka ukuthi ke mhlambe khona yini ama operations eseke wanawo ke, washo ke wathi cha ke mhlambe ke idakamizwa, i-cocaine noma yini ke, naloko wachaza ke wathi cha.
And then we went on to check if one of the random checks that we do, it's when last was the patient been to a hospital, because it's quite very important. In most cases, when patients come in, they tell you, I've been to the hospital 4 or 5 times, and we ask them, what's the issue in the past 5 years? What's the issue? They say they don't know. So we need to check whether they've been to the hospital, so that if the patient has been to the hospital and they're really not sure of what's really happened with their state or their disease or whatever they have, we shouldn't proceed with certain things without making that sure. So we ask if they've been to any, they've been hospitalized in the past 5 years. They said they've never been. Specialists, they say they have never been there.
Buzeke nokuthi ke kule minyaka ke emihlanu endluleke suke waya yini esibhedlela ke la ukuthi mhlambe khona ke ulaliswe khona ke, ngoba sifanele sazi uma kuukuthi ke ngempela kunjalo ukuthi ke yini ke ekuhluphayo, ngoba sikwazi ukuthi singaqhubeka ke senze umsebenzi singazi ukuthi umuntu uhlutshwa yini. Ushilo ukuthi cha, buzile ukuthi usuke waya wabonana yini ne-specialist kuminyaka emihlanu endlule, nalapho aphendula khona athi cha.
And then there is a medic alert member. Medic alert members are individuals that are within a community whereby they need to have either a net lace or a brace to show that they have any sort of condition that needs to be paid attention to. It could be whether the patient is medically retarded, or the patient tends to be schizophrenic, in order for us to be able to identify that if the patient maybe gets into their medic nature and we don't know what's happened with the patient. So we asked them if they have any sort of those markings, so we're supposed to know about them, and they said no. And also checked if the patient has asthma as well? And the patient said no.
Okulandelayo ke ukubuza ke nokwazi ke ukuthi lokhu ke ngendlela ekubhalwe ngayo lana ke i-medic alert member ilana ke nabantu ke ozothola ke ukuthi ke kumphakathi loyo kunabantu mhlambe omunye ke une brace anayo ke noma efakiwe ke la esandleni omunye ke une necklace ayifakile echaza yakho noma eshoyo ke ukuthi lo muntu loyo ke kukhona ukuthize okumhluphayo ushilo ke wathi cha sambuza ke ngesifubani noma ke i-asthma nalapho washo wathi cha akanayo.
And then already with the further details, it's the details that we actually, when a patient says yes to any form of information that we ask on the questionnaire, we state it down. I've already stated what the patient said, yes, they have had a heart problem, and then they already stated or they have reported to be admitted of a heart condition in 2014 following a mining accident, which was kind of really minor. Then we go to the vitals as well.
Bese kuthi ke manje ke eminye ke imininingwane ke bese ngishilo ke ngaphezulu ke ukuthi ke washo ukuthi kwanele inkinga ke yenhliziyo ke eyenzeka ke mining kodwa ke kwakuyinto etholakala ukuthi ke incane.
And what are vital signs?
Vital signs, usually we check the general stuff. In this case, because of us, we look at specific general notion, which is we check the blood pressure of the patient and also the pulse, which is checked by the medical people who screen the people, just to find out how the blood pressure of the patient is and also the pulse. In layman terms, the blood pressure is an indication of how the blood system of a vascular system of a patient is working, which is the blood system. If the high blood pressure, it's high, and roughly in most cases we say it's high if it's over 120, it's over it's 100 over 120. We say the blood pressure is within the highest region of the patient. So in this patient terms, we checked the blood pressure was within the rates of the expected range of it being high. So it says the blood pressure was normal for an individual. When we're saying high, what can strike the blood pressure to go high, it could be in an instant whereby the patient has been maybe immediately been in a physical activity whereby maybe they were running. Also another one could be a patient if maybe they were involved in a fight. The heart on its own will raise the blood pressure to supply certain parts of the body with a significant amount of blood. So the blood pressure will be high. It's one of the normal cases that any individual will have. The other indication of a high blood pressure is when the cardiovascular is within stress, which leads to, sometimes we have patients that we say they have high blood pressure which is uncontrollable, which in most cases can be led to systematic activities. Let's say maybe the patient is maybe overweight, or maybe they just actually in general their cardiovascular system is suppressed for somehow it's not functioning well. That's where we say the patient has a high blood pressure, and they'll put them on treatment to regulate that high blood pressure. So in state of traumas, if the patient, yes, maybe they get into an altercation with someone, they are fighting, the blood pressure immediately, we say maybe within an hour, it might be high. But if it's that case, it's supposed to turn down and go down within a couple of hours or so, depending on how severe the trauma was. If the trauma was severe, it'll probably strike up, go high, and then drop significantly. When it drops significantly, it automatically means that the patient it's even in one of these, the body is in distress and the body is losing a lot of blood, meaning that the pressure towards the body system, the blood level, it's reducing and the supply to certain parts is going down.
Uma sesibheka ke ukushaya ke noma ke blood pressure ke kunamlinganiselo ke okhona ke la esingathi ke phakathi kwakhe usithi ke liphakeme kakhulu uma liphakathi kwa100 kanye naye ke u120, kodwa lana sathi ke uma sibhala sasho ke ukuthi ke lingaphansi noma ke lila ekufanele ukuthi libe khona ke, ngoba ke iningi ke izinto ke noma izathu engabangela ukuthi ke igazi ke noma ke i-blood pressure yomuntu ke ibe phezulu. Asithi ke mhlambe umuntu ebegijima, mhlambe umuntu ke bekukhona ke kungqubuzana okukhona ke noma ke ukulwa obekukhona ke okuthatha ke isikhathi, kungayihora kungamahora ukuthi likhuphuke bese liyaphinda futhi liyehla liza khona ke ezansi. Yiyona ke esitshelayo ke ukuthi ke ipressure yomuntu imi kanjani futhi ke yini ke yini engaba imbangela yakho khona lokho.
Yes.
And then the patient.
The bottom value, you talked about the top value, the 117 and the 78. What does it
Yeah,
represent?
the 117 means it's within, we have systolic and diastolic. And then the 117, they go both together. We look at the systolic and the diastolic, and then when it comes to both of them, the one that says 117, if it's under 120, it's the one that mostly we are concerned with. It's at that 120 would say the patient has a regular and normal high blood pressure. If it's just above 120, it's when we start looking at, or maybe the patient might be maybe a bit stressed. That's why the blood pressure is up. But once it start hitting the 30s upwards, we start getting concerned with the patient has high blood pressure, meaning what it's the diagnosis of saying what they had a high blood pressure. As it goes further on into 150, the severity of it, whether it's in control, whether it's under, it's not in control.
Uma sesibheka ke lana kuyena ke u120 ila esesiqala khona ke sithi ke ila ekulindelekile ke kodwa mase likhuphula ke liya ko120 bese sibheka ukuthi mhlambe ke umuntu ke mhlambe une stress ke likhuphuka liye ko150 ke sithi ke manje umuntu ke unayo ke i-high blood pressure.
And that value 117, is it the systolic or the diastolic?
It's the systolic.
And the systolic is?
It's normal.
And it means?
It means it's normal.
Okay. Uma ke ku117 ngoba lana ke kubhalwe u117 kusho ke ukuthi ke ileli ke elinormal lelo ke noma ke ekuyilona.
And that value at the bottom, the 78?
That one is the diastolic. Also, we're just looking at if it's within the range above 90. If it's above 90, that's when we also have concern. But the most important one, it's the one of 120 because it's the one that indicates or it's the one that we look after. If the diastolic is maybe slightly a bit high, if it's not, but the diastolic and the systemic, it's normal. We kind of can rule it off as normal or within the range of saying what we can say it's not.
Lana ke kube kuno 117 / u78 ke sinala khona ke siyambheka ke u78 uma kuukuthi ke u90 yakhuphuka ke uya ku90 ila esesiqala khona ke ukuthi manje sibe nako ke ukhathazeka kodwa ekuyiyona ke esibheka kakhulu ile eku120 nokukhuphuka ke iye phezulu sibheke ukuthi noma cha.
But in short, doctor, you said the blood pressure of 117/78 is within the normal range.
Yes.
Kodwa ke kafushane nje uma ke njengoba lana kubhalwe 117/78 ileyo ke leyo engathi ke ekuyiyona noma ke ejwayelekile.
Yes, may continue. The next one.
And then there's also the pulse, which is goes hand in hand with the blood pressure. And then the pulse, we're just checking the rate. It could be, it's within, we check whether if how quickly the pulse is, how quickly the blood it's been pumped into the cardiovascular system. Usually, most people could see in movies, the person maybe has passed out and they're losing blood. They usually put a finger around the jugular area to check whether the pulse it's still there or not. So within this one, it's within the normal range. So if it drops, let's say considerably under 60, that's when we say the problem. The patient is really having maybe we say the cardiovascular system is failing, so the patient is losing a lot of blood, or the heart is giving up on pumping blood.
Bese kuthi ke la okubizwa ukuthi yona ke ipulse sobuka ke uma ubuka ke ama movie isikhathi esiningi ke uzothola abantu umuntu bebeka iminwe yakho khona lapha ubheka ke ukushaya ke noma futhi ke ukuhamba kwegazi ukuthi kwenzeka kanjani ke uma kungaphansi ke kwakhe u60 ila esesiqala khona ke manje ukuthi ke sibe kuyasikhathaza ke ukuthi ke ingabe isimo sithini.
Can you just put that pulse rate on record? What was the pulse rate?
The pulse rate was 72, so it's within the normal range.
Lana ke kwaku 72 ke esingathi ke iloko ke okuvumelekile nokwamukelekile.
Yes, may continue with the form.
And then from there, the patient had a signature whereby they had a spot for a signature whereby they can sign to say whatever they've given us, the above information is correct from their own side, and they did sign. And the date on which this was signed, it was June 22, 2020.
khona nendawo ke la khona ke esisayinda khona ke lo ozobona ke udokotela lepatient ke ukusho ukuthi ke lokhu okala ngaphezulu ke noma lokhu asitshele kona kuyilona iqiniso ilanga ke okwenzeka ngalo lokho noma ke asayinda ngalo kwakuyi 22 zika June 2020.
The time is not reflected, Doctor. Can you more or less
The
remember?
time is stated in page 3,
Isikhathi sibhaliwe ke ku page 3.
which says, if you can see due to the copy effect, it says it's 12:52 when the patient was seen,
Isikhathi ke patient yabona ngaso kwaku 12:52
when they entered to be examined, because this is the one that took place for when they were doing the vitals, which are the blood pressure and the pulse as well. That's when the time that they were seen.
isikhathi leso ke abona ngaso kuma kwenziwa konke lokuyana ukubhekwa ke ukuthi ke isimo sakhe sikanjani.
So may proceed to page 2.
So in page 2, it's the clinical examination whereby we examine the patient from the extraoral perspective, meaning where it's where we start checking the patient generally speaking and getting into certain details. So in what we do, we are supposed to check in the extraoral examination. We check the general appraisal, which is what we look at the patient and we look at how whether the patient is abnormal or the patient looks to have any maybe sort of disabilities or any sort of defect that to a normal medical healthcare professional terms, given the anatomy that we learned and the conditions that we are given, do they look, do the general appraisal look normal to a normal looking person? In this case, which is, we said it's normal, meaning when we look at the patient has no particular abnormalities. Maybe there is, I would say maybe an arm disability, or maybe the patient has some sort of maybe they're showing, or maybe they're wearing an ankless brace to show that maybe their leg is hurt or anything. The just patient look normal to not be any sort of disability. And then we check also the neck area if there is any sort of bruises, those ones we check in general of saying what if maybe if it's a patient, maybe it's a child, when we look at them they have bruises around the necks and also the face, it means, or maybe it's an assault patient, then that's when we refer to certain disciplines to be seen by a medical officer. Then they can take it further and see whether what's really happening from there. So with this patient, there were not really any sort of abnormalities when it comes to the patient being bruised, disabled. The patient really looked pretty much normal at the state of being examined.
Lana ke ukubheka ukuthi nje i-patient lena ikahle yini, akukho yini la ekubhekeka khona ke noma ebonakala khona ke ukuthi mhlambe umuntu lona ke okhubazekileke uma mhlambe asithi nje une necklace anayo noma ke enyaweni noma ebrace anayo khona lapha yana eshoyo noma echazayo ukuthi ke kukhona nje okungahambi kahle kuyena ke, kodwa ke kule noma mhlambe asithi umuntu lona obonakalisa ukuthi mhlambe ulimele la ekuzofanele khona ke andluliselwe ke udokotela ke okuzoba uyena ke osebenza ngalokho ozombheka, kodwa ke kulena ke i-patient kwabonakala nje ukuthi cha akukho okungekho kahle, konke kwakukahle.
And then we went to check the TMJ. The TMJ, it's the joint. The joint whereby the jaw joins itself to the skull. It's in layman terms, we would say it's the skull. So we call it the cerebromandibular joint. It's sitting right adjacent to the end of the ear, right over here. So what we usually look for, it's in most trauma case patients that maybe they have been hit, or maybe the patients have been involved in a car accident. There will be maybe some deviation, clicking sounds when the patient opens the mouth, or maybe when the patient opens the mouth shifts to the left or shifts to the right. So we look for those things, or whether it's a systematic fact that the patient's TMJ ligaments are not strong enough, the joint just deviates from birth. So we check those things to just know, because since we're working in the mouth, we require the patients to open wide. If the patient has any defects, they open wide, it becomes dislocated. We need to know if it was our own doing or the patient came with those issues before. So that's what the cerebromandibular joints are assessed for.
Bese sibheka ke nokubizwa ngokuthi ke ama TMJ, wona-ke ama-joint-ke uma ewachaza-ke la kulolu hlangothi noma-ke ngesenzansi nje kancane kwendlebe-ke, lokho kungabangelwa-ke mhlampe ukuthi umuntu wayeke wasengozini yemoto, mhlambe uma ngabe ekhuluma-ke kunendlela ethize-ke amazwi aphuma ngayo noma-ke aklika ngayo. Fanele futhi sibheke nokuthi-ke uma lokho kukhona-ke lokho ukuthi lokho kwenzeke kathi ela kuthina noma indlela afike engayo leyo.
So, and also,
Noma futhi uma ngabe ekhuluma uyabheka ukuthi mhlambe ngesinye isikhathi uma ekhuluma umlomo wakhe ushifela ngaku left noma ngaku right.
yebo. Check that as well. And then also we went to the lymph nodes. Lymph nodes
Yes,
is
just before you proceed, doctor, what was the clinical finding regarding the TM joint?
they're normal. They look normal. The patient didn't look like they had any disabilities or anything that's off. That's why in the paper we ticked normal in regards to that.
Ilapho-ke uma ubona lana kule form kuthikiwe-ke unormal ukuthi-ke ungokwenjwayelo noma ngokwejwayelekile-ke ngoba-ke masimbheka nimbuka-ke ngimbona abonakala-ke ukuthi akukho nje okungekho kahle noma ongekho ngendlela.
And the one that we also check, it's one of the most important ones, is the lymph nodes. Lymph nodes is the lymphatic system. It has a number of functions. It's maintaining the fluids in the body. Usually what really happens is with the lymphatic system also maintaining fluids, meaning or if there is any infective fluids that's within the body, maybe the patient has an infection or they had any fluid irregularities regarding that's threatening the immune system. It's the line of defense for the immune system. So if they're having those issues, practically when we check them, we palpate them to check whether if they are swelling or they are palpable or they are normal. So most of the time when they become swollen and they're a bit palpable, that's when we say maybe the patient has an infection. So in regards to us, we check the lymph nodes of the neck and the submandibular. Submandibular is just below the mandibular. There's a triangle between the neck and also the mandibular, which is the lower jaw. So we palpate there to check whether they are abnormal or they are normal.
Lana-ke ukubheka-ke ukuhamba nje kwama-fluids-ke emzimbeni futhi-ke lokho kwenzeka-ke kulolu hlangothi-ke lentamo-ke nokubheka-ke ukuthi futhi ku-normal noma akukho normal yini noma kunokuvuvuka okutholakalayo khona lapho noma cha.
Doctor, just explain palpate.
Palpate, we wear gloves and then we go around the area where the lymph nodes are. We smoothly press on them to hear whether there is any sort of hard surface that's there. If it's hard, that means the patient could be having a systematic, the lymph node system, it's failing. In most cases, minimal rates, they usually like stating in cancer patients when they are actually really sick and then it's spreading quite quickly. You find that the lymph nodes are more swollen, but infections, they become a bit more tender and then the swelling shows it's not really as severe. It's only when they have serious health issues whereby they become very much hard and swollen.
Lana-ke uma senza lokho-ke sithatha-ke noma sigqoka-ke ama-gloves la kuthina-ke ezandleni bese siwabeka-ke khona la ukuzwa-ke ukuthi khona yini okungekho kahle-ke noma futhi-ke isimo sangakhona sithini-ke lokhu kuyenzeka-ke ngenye inkathi ukuthi ukuvuvuka lokhu-ke kube kakhulu-ke ikakhulukazi-ke kuma-patients-ke ayo-ke i-cancer. Kodwa-ke lana-ke uma kuphathelene nayo-ke ama-fluids lana-ke wona-ke ayathanda ukuthi kube khona-ke indawo engathi iba lukhuni-ke khona lapho ilokho-ke esikuzwayo uma sesifaka wona sigqoka lawo ma-gloves.
So in this case, the patient's lymph nodes, they didn't look abnormal. We take normal, they looked normal. We didn't find any irregularities when it comes to that.
Asizange-ke sithole lutho-ke kule patient-ke esingathi-ke kwakungahambi kahle noma kungekho kahle.
Now, doctor, except for infection, is there anything else that can make the lymph nodes to be hard or swollen?
Yeah, in states whereby in very specific states whereby if maybe the patient was involved maybe in an accident or maybe they were assaulted and maybe they get fractured and then maybe they are not medically attended to, it could lead to opportunistic infections that leads to the lymph nodes being swollen to indicate that there is an area in the body that's open, that bacteria is getting in or virus is getting in and it's infecting the body, that needs to be paid an attention. It's more of an indicator of whether the immune system it's functioning well or it's failing.
Lana ke lokhu kuba kona ke inkomba ke yokuthi ke mhlawumbe umzimba lona ke noma immune system ihamba kahle ke isebenza kahle noma cha iyafela ke lokho kungabangelwa ke into ezahlukile ke ukushaywa mhlawumbe umuntu ke ayisengozini ke yemoto futhi ke manje akwatholakala ke ukuthi ke athole ukunakekelwa noma ke ukulashwa ke kwalokho bese ke tholakala ukuthi kukhona ke lana ke mhlawumbe ke uma sekungena ke kube infection itholakala ngaleyo ndlela.
And then we went on to the palate. The palate is the roof of the mouth. Whenever anyone takes their tongue up.
Sorry, doctor, just the intraoral exam.
Oh yes, it's sorry from I'm walking past through. Sorry about that. The intraoral exam. When we come to the intraoral exam, it's the inside the mouth. That's where we start looking at what's happening inside the mouth. Mostly, we check certain parts of the mouth. In their face, we have the lips and we have the buccal mucosa. So when we say the lips, we're referring to normal lips, the ones that we speak with. And when we're talking about the buccal mucosa, we talk about the space between the teeth and the cheeks. So in that fashion, when we look at the lips, we look at within the lips whether there is a fleshy red, which indicates that maybe the patient has some sort of trauma. The mucosa was hurt, or it was it has blood clots to show that maybe there is any sort of trauma that happened there. Because in general, it's supposed to appear pink. In general, it's supposed to appear a relative color of pink. And most cases you find with the other patients, it's not pink due to hyperpigmentation. It's something that happens systematically. It's an abnormality, but not really of concern, because due to our melanin, the type of color that other people are, they will have more pinker gums, but there is a certain type of fleshy red, and also sign of blood clots within the mucosa that indicates that there could be any sort of trauma, or also if there is ulcerations to show maybe there is some cuts that happen there. Trauma could be caused by anything. It could be the fact that maybe the patient was hurt, they heated a chair and then the lips bounced on the teeth, or if maybe, for example, maybe the patient has some ulcers that were caused by maybe something they ate, or maybe they have some disease, like maybe they have herpes or the beginning of an oral cancer. So those will be the irregularities. But when we don't see those things, or fleshy red, or seeing any ulcers, or we see any sort of indicates of maybe there's a bit of blood clot within the mucosa, we rule it as normal. That's what we take here.
Lana ke uma sesibheka ke ngaphakathi ke emlonyeni womuntu ubheka ke ukuthi mhlawumbe khona yini ongathi mhlawumbe uthola ke kubomvuke ngaphakathi emlonyeni okungabangelwa ke izinto eziningi ke ukuthi mhlawumbe umuntu ushayisekile ke khona la anqubuzeke khona ke mhlawumbe asithi nje esitulweni ke kwase ukuthi ama lips akhe ke ashaya ngaphakathi ke ngoba ke ngokwenjwayelo ukuthi umuntu ufanele ubone ngaphakathi, uma ubheka ngaphakathi ke ubone ke umbala opink, kodwa akusiyena ke wonke umuntu la uzobona khona ke upink, ngoba abanye banezimo ke abakhule nazo noma ke abazalwe noma abadalwe benazo ke kungenzeka kungatholi ke loyo pink loyo. Lokho ke okungabangela ukuthi ube uyabona ke manje loba bomvuko obungaphakathi ibona ke mhlambi obungabangela ke ukuthi umuntu abe nama ulcer. Ikona ke esikubhekayo uma sisibheka ngaphakathi ukuthi nje konke kukahle kungendlela yini ngaphakathi emlonyeni womuntu.
And another thing that's also there that we check is the oral pharynxes and the tonsils, which they are situated at the back of the mouth. It's they're saying it's the end of where the oral cavity ends, and then it's where the trachea, in layman's terms we call it the throat, begins. So the reason why we check these two is they're also associated to sort of infections. If maybe a person says, or they have tonsillitis, you find out their throat is swollen, is due to maybe a viral infection that could be in the system, especially in the oral cavity or in the upper respiratory system. So, meaning also the oral pharynxes, maybe some of them, they could be maybe appears if they are blocked, clotted. Those ones we look at for, it happens with most of the patients that have an electric shock, whereby they're allergic to something, and then they might end up maybe needing adrenaline to relieve that electric shock. So we check for that. We allow the patient to open their mouth, and then we tell them to depress their tongue down, and then we use a mouth mirror that's almost as if it's a spoon, and then we look exploring at the back to check if whatever is inside the mouth or whatever is happening in the face, is it affecting the tonsils, because the tonsils also, they are part of the lymphatic system, because you could miss the lymph nodes that are on the submandibular and also on the neck, but the infection could be progressing itself at the back in a form of tonsillitis.
Bese sithi ke manje ke lana ke sengicela khona ke patient ukuthi ke avuleke umlomo ke futhi ke abese ecindezela ulimi lakhe ke ila esofaka khona ke isibukeke esingathi ke isipuni ke isona ke esikhombisayo ke noma ke esikwazi ukuthi sibone ngaso ngaphakathi ke ngasemuva ke emlonyeni, ila khona ke ama tonsils umuntu atholakala ngakhona ke, ila futhi ke ekuqala khona ke umqala ke, ngoba ke manje sesifuna ukubheka ke ngaphakathi ke ukuthi ila khona ama infections nawo athi atholakale khona.
Would any trauma to the oropharynx and tonsils affect the way they look like?
In instances, maybe we would say the patient, there is a trauma to the neck, and maybe the trachea it's been bruised, or there is any sort of trauma to the neck. Most cases, sometimes, if it depends on the severity of it, how bad it is, it can progress itself with maybe the patient appears to be having a swollen trachea from the inside of the mouth. It could pronounce itself as that way. In severe cases, meaning what, sometimes patients could have assaults, there could be heat, there could be done whatsoever, but since there was no any sort of hits or trauma to the neck or maybe to the face, that might not have any sort of disabilities on that.
Asithi ke manje umuntu lana ushayiweke noma ke ushayiweke, lokho ke futhi ke kuzoba nomthelela ke, ngoba ke manje kufanele ke sesiyobheka ke ukuthi ke ukuvuvuka okungathi kube khona ke ikakhulukazi ke emqaleni ke, kodwa ke uma kuukuthi ke cha ke akukho kwenzekile akashayiweke, lokho ke akukho ke nje ozokubona noma kuzotholakala.
So, and then we move to the palate. The palate is the roof of the mouth. Everyone who lifts up their tongue and then put it on the, I usually say in most cases to layman terms, is for patients who report to maybe they have irritation of the nostrils, they really put their tongue on top of the roof of the mouth. So usually when we check in our field, we just check whether the palate is showing any sort of let's say ulcers, maybe there is any lesions that's there, maybe let me just say lesions coming from any sort of disease that's there, maybe the patient has nasopalatal cyst that's there. Those are the things that are more disease related. So in most cases when we check for that, we just check for the disease part of it. We don't look for any sort of trauma, or we look for any sort of condition that's associated beside the diseasal part of the body when we check the palate. And also the size of it, whether it's deep enough, whether it's wide enough, those are the things that we check.
Akunye futhi ke bese kuthi ke ipalate ke ila ke ngaphezulu ke emlonyeni ke la umuntu acelwa khona ke ukuthi manje akakhuphulwa ke noma ke anyuseke ulimi lakhe, ubheka ke ukuthi akhona yini ama disease atholakalayo ke ngaphakathi ke ama ulcer noma kuyini ezotholakala ngaphakathi ke la emlonyeni uma ukuthi umuntu ukhuphule ulimi lakhe walibeka la phezulu.
And then from there, we check the floor of the mouth. Usually we ask the patient to lift up their tongue into the roof of the mouth so we can check the floor of the mouth. Those are also it's disease related and also systematic, because when we check the oral cavity, we want to find out one of the things that we're more interested in is the thickness of the patient's saliva, the thinness of it. So underneath the floor, underneath the tongue, which is the floor of the mouth, it's where salivary ducts are. Salivary ducts are secretors of saliva. So we want to check whether it's blocked, it's clotted, or whether any of it is hurt, because that might affect the thickness of the saliva, in which the rate in which the patient secretes a lot of saliva or secretes low saliva, but because those also affect the patient's breath and whatsoever, but it's more of a systematic notion. It has nothing to do with any other thing except for the systematic notion. We would say maybe in cases of traumas, yes, we would check maybe if the patient has severe trauma, the jaw is broken, there's dislocation of the jaw, the floor of the mouth will be affected. And that's when maybe we'll also check if there was any nerve that was damaged that runs through the floor of the mouth, which is the lingual nerve. And those are the things that mostly is, but most of them we check for the systematical part, how it's going to affect how we're going to treat the patient for us.
Lana ke indlela ke ezositshela ke noma ezositshengisa ke ukuthi sizosebenza kanjani ke nayo ke i-patient lena, ngokuthi ke simceleke ukuthi ke aphakamiseke ulwimi bese sibheka ke la phansi ke emlonyeni, sizobheka ke ukuthi mhlambe khona yini ukubloke kokukhona ke kwawo ke amatheke, kanye futhi noma ke khona ke mhlambe ukungahambi ke noma ukublokeka kwalo igazi. Ubheka nje indlela yokusebenza uma sithi ke akaphakamise ulimi, sizobheka la phansi emlonyeni.
And also we check the tongue. The tongue, everyone knows, we all know the tongue, it's the one that's sitting in the middle of the mouth. So in terms of it, we're just trying to check if the tongue has any sort of radiant color. Maybe there is a certain pattern that we see that we don't understand. The pattern, we're only talking about lesions only, and then also the color, we're not really most concerned about it due to pigmentation. Some patients' tongues would have maybe browner spots, but if those are the things that we tend not to put much focus on, because people differ in regards to that. But we're looking for any sort of lesions. If the tongue was cut, the tongue is bruised, whether the tongue has any ulcers that's there. Ulcers could indicate that the patient maybe is having some sort of rare cancer, or they're just having some reaction to whatever they ate or something else. That's what we're checking. But in most trauma cases, if we have a trauma or we have a patient that's been assaulted and whatsoever, yes, we check it to just check if maybe it's swollen, because if it's swollen, we need to put a careful attention to it, because it ends up blocking the mouth, the throat at the back, and then it affects the breathing of the patient. But besides that, we also check if there is the tongue, the size of the tongue. We have some patients who have larger tongues, meaning when they close their mouth, they put their tongue on the floor of the mouth, it gets depressions from the jaws. We just check for that, because it also can affect certain function of the patient, meaning it could lead to the patients having some, speech problems, which could be one of the factors. But those are one of the things we're saying. It's systematic. It's some follow-up of disabilities that we look for.
Uma sibheka ulimi ke iningi kakhulu ke izinto ayibaleke eyibhekwayo ke ukuvuvuka kwalo ke mhlambi ke kubangelwe ingozi ke ukushayeka noma ukushaywa, ubheka mhlambi ukuthi ke kunokusikeka okukhona yini olimini. Ngenye inkathi uthola ke ukuthi abanye abantu ke siyazi ukuthi umbala olimi ngiyawazi ukuthi unjani, kodwa kuthola abanye ukuthi kunama spots ke abrown akhona, kodwa ke akusona izinto lezo esigxila kuzona, kodwa ke ukushayiseka ke okuzokutshela ukuthi mhlambe khona okwenzekile. Abanye abantu uzothola ukuthi ke nabo ke amalimi abo awalingani, abanye banamakhulu ukundlula awabanye.
Dr. C, the clinical funding is not indicated here.
Yes, usually in most cases, it becomes quite very tricky to point out, especially when it comes to the tongue. When we can't find anything that's really abnormal, we don't really mark it as normal, because in most cases the tongues are not all the same. So it's enlisted here to check whether it's normal or it's abnormal, meaning most cases when we see no disability or abnormality, we just don't tick it, because the normality of it's not standard. So in this case we didn't tick it, because there is no absolute standard, like I stated, for example, with the lips and the mucosa saying, or most of them has to be pink. So with it, the colors vary, and we're just looking for the sizes, the ulceration. So if we find those, then we're going to tick abnormal and then write the Antony there. So write whatever we found that's abnormal. But here we don't tick because we're actually saying the patient's tongue, it's up to standard selection. So we don't really tick that because of that fact.
Lana ke kuyangabhala lutho ke eduze kwaloko elwimi ke ngoba ke akukho ke ngoba sizothi ke ulimi lakhe ke umuntu noma i-patient leyo ke ngathi ke kuloko ke okulindelekile ngoba ke kona ke akufani nezinye la uzothi khona ke yilokhu nalokhu okulindelekile noma ke okufunayo kulona ke ulimi ngoba ke sibheka nje ukulimala ngoba kube kunokulimala kunokusikeka okukhona ke ila bese uthika khona bese siyabhala ke eceleni.
So in other words, there were no abnormalities
Yes.
detected.
If there were abnormalities, we were going to tick abnormal and then write the abnormalities that we actually came across.
Uma ukuthi kukhona ke kwakukhona okwatholakala kulona ke ulimi sasothika ke bese kuyabhala ukuthi yini leyo etholakele.
Doctor, can you just place the clinical finding of the floor of the mouth?
The floor of the mouth clinical findings were the floor of the mouth was normal. It wasn't too deep, it wasn't too shallow, it was up to normal standard that we look for. There was no lacerations, there were no ulcers in that regards.
Uma sibheka ke la phansi ke emlonyeni akukho nje okwatholakala ukuthi ke mhlambe kunama ulcer kukhona nje okungabukeki kungendlela ke yilakho ke kubhaliwe ke noma kwathikwa unormal.
Yes.
So we're going through to the gingival and the periodontal. These are the more invest stuff in the dental field, which is the gingival. It's part of the gum that we say it attaches to the tooth. It's in most cases it's the free part of the gum. When we examine the patient, we usually take some sort of probe in between the tooth and the gum, a very, very thin, I would say almost needle thin standard, where we put inside, it has markings to check the length and whether it's too deep or whether it's it's reduced from normal standard compared to the other ones. And then the periodontum, it's in layman terms we would say it's the cushion. We call it the cushion. Is the ligament that's between the bone and the tooth. The cushion that we're talking about, let's put it straight, it's like it's the cement to brick laying. So in order for the tooth to be attached to the bone, there has to be a periodontum there. So if that periodontum has a disease, that means the teeth won't be stable. It will start moving upon maybe patient chewing, or even if the patient touches it like this, and then it will start moving, showing that there is no cushion in between to stabilize the tooth. That means it has a disease, it's been reduced, and it's been affected by bacteria, and there's some sort of infection inside there. So in regards to that, we check the level of it, and we check wherever it have any sort of infections that's there. So with this patient, the only thing that we noticed, it was that there's gingival recession. Gingival recession, we're just talking about the fact that the gums, relative to other ones, they're showing that the gums are not attached to the cervical part, which is the end of a crown. A crown, the tooth, is divided into two parts: the crown and the roots. So the cervical part of the tooth, it's where the tooth starts becoming a root. So if it's reduced below that part, we would say it has a recession, it's gone under. So that one, it's also a systematic part. It's caused by maybe long-standing plaque that resulted into bacteria, end up eating away the gum, infecting it, resulting for it to eroding and then reducing. So when we check the patient, the other factor is if the patient has maybe a habit of using maybe a harder brush. We have patients who use a toothbrush for like maybe a year or two, and then the toothbrush, when it becomes hard, it ends up corroding, and the gum is a very thin and sensitive part of the tissue, to a point whereby even if you chew a bone, you make a mistake, it hits the gum, you can end up having the bleeding of the gum. So, but if you're constantly brushing on that free part that attaches there, you're corroding it, then it ends up being resected. So it's one of those things. In this case, we found out there were 3 teeth that had that, and it was the tooth on the 4th quadrant, the first one on the lower right side, and the second one on the lower right side as well. And then there was the first one on the lower left side that had that part of recession.
Doctor actually saying what happens to this client here in this one, this patient? What is doctor actually saying?
In this case, it was abnormal, just due to the fact that maybe when we look at it, we do further investigation by asking the patient whether they, in this case, it looked like
The
maybe it
teeth
was
and the gum.
the gums
Okay.
were abnormal.
Lana ke esikutholile ukuthi kuningi lokushiwo amagam ale patient ayengekho normal.
And then from there, we go to anger classification. Anger classification, it's our part for classifying the way in which the patient bites. You know, certain relativity of a certain tooth from the upper to the down, the way in which they come together to classify whether the patient has abnormal teeth or normal teeth according to a certain standard that was drew from a survey that was made at the beginning of dentistry to classify patient's identity via the grouping of the way in which the teeth are. So the patient is on the class 1, meaning what it's a standard classification of a normal occluding teeth of a patient.
Uma sekubhekwa ke noma kuhla ke noma ke kuclassifywa ke amazinyo ke mhlambi ke indlela ke ongathi ke uhlafuna ngayo ke uma kubhekwa ngokwama class uzathi indlela ke lena ejwayelekile noma ekuyiyona ke elindelekile ngoba ke yona ke uma beclassify kube kutholakala ukuthi uclass 1.
Yes, and the only findings that were different from the patient's teeth relativities is the fact that they had spaces in between their tooth, which sometimes some patients do have, sometimes patients don't, due to their jaw being bigger than their teeth. So the teeth tend to try and spread out and fill up the space. So also that one, it's a normal thing that comes with the patient. Patients are born with it. Some is due to maybe the patient removed teeth early and whatsoever. In this space, in this instance, the patient has interdental spaces, meaning or between the teeth that are in the first quadrant, the front one, there were spaces, but it's just whether some patients have it, don't have it due to certain factors that took place, whether they were young or it's just a heredity thing. Because some families you find all of from the mother to the child, they have gaps, because that's how the family is.
Lana ke ukuthola nje ukuthi ke amazinyo lomuntu ahlangane yini amanye uzothola ke ukuthi kunama space akhona ke abanye benziwa ke ukuthi ke ufuzoko lelo ukuthi mhlambe ke indlela akhule engayo khona okwenzeka esemncane ke kodwa uthola nje ukuthi nje cha kunama space akhona ke phakathi kwamazinyo abanye banawo abanye abanawo.
Doctor, if I can just maybe briefly take you back to the previous clinical finding regarding the gingival recession on the 4th quadrant and the 3rd quadrant. Is that in any way related to oral hygiene?
Yeah, it's related to oral hygiene. Could be poor oral hygiene or the patient's inability to have oral intelligence to know on how to brush their teeth, on how not to brush and when to change their toothbrush. So it's mostly related to we call it an oral hygiene standard, because oral hygiene, the instructions, it's when it comes to how patients knows how to clean their mouth, when to clean them, what to use. So it's oral hygiene related.
Lokho bekuchazwe ngaphambilini ke lokho okubizwa ngokuthi yona ke i-gingival kuhamba ngokuthi ke indlela ke umuntu ke anakekela ngayo amazinyo akhe ukwazi ukuthi kufanele awaqhubhe nini ke nokuthi futhi kufanele ukuthi ke i-toothbrush futhi aqhubhe kanjani nokuthi i-toothbrush ishintshwa ngasiphi isikhathi noma emuva kwesikhathi esingakanani.
Does trauma play any role there?
In most cases, no. Unless if maybe the only part it will play if maybe the patient had sort of tooth fractures that leaded into maybe the teeth wanting to be brought back in by aligned back, and maybe through the process of trying to align them back, maybe there could be a bit of gum cutting to try and balance the teeth, put in plates and whatsoever. Those we only see in patients that have been treated for trauma, not in an instant whereby the patient is kind of really traumatized.
Futhi ke nokulimala ke kuba nawo ke umthelela ke lapho bona ukuthi mhlambe bekhona ke ukulimala obekukhona ke mhlambe amazinyo ke afuna ukubuyisela kwisimo sawo noma ngendlela ke ebekade engayo ngaphambilini noma ngaphambi kokuthi umuntu athole ukulimala.
But in this particular instance, the gingival recession, doctor said it was due to poor oral hygiene.
Poor oral hygiene, yes, which showed that the patient's oral hygiene wasn't really, it was fair. We would say it's fair, it wasn't really that much poor, but it was really fair because there were certain teeth that were really affected. We wouldn't really say we when it comes to the oral hygiene, we would say it's poor, fair, and then we would say it's good. So with the patient, it was, would say in terms of the rating of it, it was fair. Fair meaning what it could be poor, it could be good when we look at certain other parts of the teeth.
Uma ke lana uhlanganisa ke amazinyo ke ubheka ke indawo ezithize noma ke amazinyo athize ke kanye nokunakekela ke wona ke amazinyo noma umlomo ke lana singathi ke kwakumaphakathi nje nendawo ke ngoba ke ungathi ke uphuwa noma ugood noma ufair lana ke maphakathi nendawo ngendlela ke anakekela noma ke xubha ngayo amazinyo.
May continue.
Yes, and then from there we have this charting. It's a charting that I already explained at the beginning when I was talking about the teeth that were being extracted, that we have the first quadrant, we have the second quadrant, we have the third quadrant, and we have the fourth quadrant. In detail, it's the charting that we use to mark which tooth is rotten, which tooth is missing, and which tooth needs to be filled, which tooth is broken. So we have certain markings that we mark on the chart. If you look at the chart that we have here, we have the 1.5 and the 1.7 and also the 4.8. They have zeros on top of them, and also the 2.8 and also the 3.8. They have zeros on top of them. The zeros is an indication of the fact that if they are zeros and they are not shaded inside, they're just a normal zero. It shows that the patient has caries, meaning the tooth is rotten, it has some black spot that needs to be restored. But if it's shaded, it means the patient has had fillings, and the fillings are inside the mouth. We're just marking points whereby the patient saw a dentist and then fillings were done. So, and also if there is a dash that's cancelling a certain block, it shows us those teeth upon examinations, they were not there. As I already stated at the beginning, the patient said they removed teeth. So the teeth that are missing is the 4.4 and the 3.5 and the 3.7 in this case.
4.4, 3.5, 3.7. Lana ke uma sibheka ke kule chart lena ke ila ebese ngichazile ngaphambilini amazinyo ke kuya ngokuthi ke izinyo mhlambi elikhishiwe elibolile mhlambi izinyo nje elavalaka noma ke eline filling futhi ke abhaliwe ke laphayana lana ngathi ke kwakuwona ke said these ones were removed ne 4.4
Yeah, 4.4.
u4.4 u3.5 kanye futhi naye ke u3.7 yilawo ke athola ukuthi kwakuyiwona ayekhishiwe.
So those are just the markings that we do for our own purpose to know how we're going to go about the treatment.
Lokho ukusisa nje thina ke ukusitshela nje noma kube inkomba ke ukuthi sizosebenza kanjani.
And then when we go to page 3 is where we write notes, collaborating from the examinations that we have done, the questionnaire, the intraoral examination, and also the charting. It's more of a summary to brief anyone who's going to come, read the document if maybe the markings were not marked correctly, to briefly state those things or what's really happening there, and then we bring it up forward. If you check on the page 3, it starts by showing the date, and then the operator, which is my name is stated there, Dr. Trokoti, and the treatment or progress notes. So in this case, it's progress notes or whatever the treatment was really happening with the patient in these terms.
Lana ke ku page 3 ama notes ke nje manje ukuhlanganisa konke ke lokhu esekwenziwe ke ngaphambilini ukuchaza ukuthi imuphi umsebenzi uqala ke kumibuzo ebuziwe umsebenzi owenziwe naloyo ozobheka noma ozofunda ke futhi abesebona ukuthi yini eyenziwe.
So we are trained initially to explain how we started off the patient, which is in any patient that we treat, we need to practice infection control, which is we need to wear gloves and masks. So here I stated GM. Those are the codes that we use to explain or gloves and masks were worn. And then also I wrote sterile instrument to show that the instruments that were examined the patient with, they were also sterilized, meaning they were put in an autoclave. They were fried to a certain temperature to remove any sort of bacteria that's there.
Bese kuthi ke kuchaza ke kunama code ke esiwasebenzisayo ke uGM ukuchaza ke ukuthi ke ama mask kanye nama gloves ayifakiwe ke kanye futhi ke naloko kwasetshenziswa ke noma ama instrument asetshenziswa noma ukuthi ngaphambi kokuthi asetshenziswe ke nokuthi ke futhi ke eyahlanzwa ke.
And then I stated the full method examination was done. The report back, it's the thing is when you do a report back, you need to also state that whatever initially the patient was asking for you to check or what you were looking for, whether it is confirmed, found, or it's not. So in this case, I was informed that I'm looking for a tooth that is either it shows that it was chipped or it shows that a gold was removed. So I wrote here that upon examination what really happened, what I found.
Lana ke bese kuthi futhi ke ngichazeke noma ngibhaleke futhi ke umlomo ke ngawubheka ke ngaqulonga ke uwonke kanye futhi ke nokuba sekubhala ke futhi ne report back umbiko ke lana uchaza ke ukusho ukuthi lokhu engakutshela yona ke i-patient uma mina ke sengiyibhekela ke ngakuthola yini lokho engakutshelwa.
So in this case, I wrote that the patient shows no sign of cosmetic fixed prosthodontic work done on them in the teeth that were present. Prosthodontic work we're referring to inlays. Inlays, we're talking about dental crowns or we're talking about gold. Those are the cosmetic, meaning or there are things that patient option to have due to them looking appealing, not because they have a certain condition, unless in a crown state whereby they are forced because the tooth is broken into half. But in this case, there were no findings regarding that, meaning there was no tooth that showed that there was a gold tooth the patient ever had that came out of the mouth.
Lana ke nokuchaza ke nokusho futhi ke kungekho izimpawu ke ezishoyo ke ukuthi ke kwakunama nezinyo ke noma mhlawumbe ke izinyo legolide ake nalo noma ke elakhishwa emlonyeni wakhe.
So the other thing that I also had to do is note something that I would say maybe it's of particular concern. It's I realized the fact that the patient's teeth, the front ones, we say the front top three ones, which were the two ones were on the second quadrant and the other one was on the first quadrant. They showed sign of demineralization on examination, showing that it's a wearing off of the enamel of the tooth. It could be maybe due to lack of calcium, or it could be maybe lack of a lot of acid consumption, or deformity of the tooth, its structure not being strong enough to withstand certain acids and other things. So it's a more of what the patient consumes and what the patient's development from a child, how it has been, because some patients decide to have demineralization, they end up having demineralization due to the fact that they have maybe some maybe calcium defect whereby it led into the tooth not being developed in the certain way in which they were supposed to have been.
Lana ke ngathola ukuthi ke kumazinyo amathathu ke ala angaphambili amabili ke kuhlangothi la ngasokudla elilodwa kuhlangothi la ngasokunxele ukuthi kwaebonakalisa ke noma enezimpawu ke zokuthi abonakalisa ukuthi ke khona ke ukonakala okukhona ke lokho okungabangelwa ke izinto ke ezahlukile ukuthi mhlambe ke uma esekhula ke noma mhlambe ilokho umuntu akuthathayo ke manje noma ke okuyikona akufaka emlonyeni wakhe okungabangela ukuthi ke bekhona lokho yakonakala engaqaphela ke kulamazinyo amathathu.
And brushing cause that condition?
I would say in very rare cases, whereby also brushes, in order to cause that, the teeth have to not be strong enough for that to happen. Because even if the only thing that a brush can actually cause tearing of the tearing of the tooth, it's demineralization. It's in a case whereby there's just a systematic fact. It's not an external fact whereby a person can actually demineralize their teeth. It's something that we would say it's some sort of tooth disability we're looking at.
Angeke ke uqubha ke noma ke ibrush kube kuyona ke engakwenza ke lokho asithi nje kungaba nje mhlambe ke asithi nje izinyo ke uma lingekho kwisimo esikahle okungabangela wona lokho kodwa hayi uqubha.
So in conclusion, I also signed here for this part, and then these lines that we use is usually for these documents to avoid, or if there is any person who gets a hold of the document, they don't add any sort of information. So we draw lines to indicate that this space it was not filled by the examiner. Meaning, or if somebody's going to examine the patient, they need to get a whole new page of this and attach it at the back. And then that's the reason why for the margins and the cancellations underneath the notes.
Bese kuthi lana ke ila engaqeda khona ke bese kuba nama lines ke akhona ke abhaliwe lapha yana ke ukuchaza ke ukuthi uma kuukuthi mhlambe kunomunye umuntu ke ozofika afike ke naye ke afune ukubhala lapha yana ukuthi ke cha kuyofanele lokho ukuthi uyothatha elinye iphepha ke engabhaliwe lutho kulona ukuthi lo ebenza umsebenzi la yena ke uqedile ingako kudala ama lines akhona lapha yana.
And then the final, the last parts of the documents includes us talking about the diagnosis. The final diagnosis from what I have diagnosed from actually viewing the patient's mouth, and what is the abnormalities that's there. So in here, the diagnosis was, I wrote the patient has calculus. Calculus, it's when plug progress from where it's being in a soft format, it goes into a hard part whereby it sits on the gum. It's the part that end up in later resulting in the gingival recession that I spoke to about there, because the bacteria now it has grown and it's getting to a certain thickness. It's starting to even feed on the free gingival, which is the gingival they were talking about. So it led to the recession that we were talking about on the other side.
Lana ngibhalile ke uma sengifika ke manje emaphethelweni ke noma lokho engakuthola ke ngibhaleke lana ucalculus kolokhu engichazile ke ngaphambilini ukuthi bakunele inkinga ke eyatholakala ke ngokuphathelene nawo ke ama gums akhe ukuthi aye nenkinga ke ila manje esendlulela ke la ku stage son ukuthola ukuthi ibacteria manje ise iyakhuphukela iloko engikubhalile egcineni.
And Dr. I know you've already mentioned the word plug, but can you just explain it?
Plug.
Plug, yes, plug.
Yeah, no, plug, it's in general, in normal terms. Plug, it's the development of, it's when it's long-standing, an individual has been consuming any sort of products. It could be cold drink, it could be normal food or an apple, and there is no proper oral hygiene practice, meaning the patient doesn't brush their teeth regularly, as we usually indicate, twice a day, in the morning and at night. So the food tends to remain close to the teeth, and then when they remain close to the teeth, they end up feeding the bacteria, which is found inside saliva. Saliva in general has a normal flora meaning like any other fluids that are coming out of the body. Most of them have bacteria that's it's normal, it's standard to people, but it goes overaged when it's fed certain quantities. When I'm saying, or in giving a normal example, it's when we say we have maybe a certain patient who is explaining it in layman terms, who has diabetes, and they indicate to them or they must stay away from salty, sugary things to make the diabetes standard, and it doesn't go overboard, and it leads to other systematic effects. So we're saying that with this patient, the normal flora, because it's fed things that it's not supposed to be fed, it grows and then it calcifies and then it attaches to the tooth, and it starts in a soft format. That's when we call it plaque. But if the hygiene, it's progressively it's fair or maybe poor, it can progress to calculus. So that's what plaque is.
Lana ke esichazayo ke ukuthi asiqale ke kule la esithi khona ke ukunakekelwa ke kwamazinyo ke noma komlomo ke kungenzeki ke ngendlela ekufanele ukuthi kwenzeka ngayo. Vamise ke ukuthi ke umuntu ke akaqhubheke amazinyo kabili ngelanga noma ngosuku ke mhlawumbe ekseni futhi ke nantambama lana uthola ukuthi akwenzeki ke ngaleyo ndlela, bese kuthi futhi ke uthatha nokudla ke noma udla ukudla ke mhlambi lana lokho kudla bese kundlulela manje sekusondela ke noma kuyohlala ke kulona ke izinyo, bese kuba yikona ke manje lokho okubangela lokho esikubiza ukuthi ke iyona ke iplaque. Ubese enza ke isibonelo ngomuntu ke onoshukela la echazelwa khona ke ukuthi ukudla okuthile kufanele ungakudli ngoba ke lokho kuzoba nomthelela ke empilweni yakho, yikona ke lokho okwenzekile noma engikutholile ke kuyona the patient.
And then we say the other finding is there is irreversible pulpitis. I'm going to put it maybe in layman's terms. We're just simply referring to the fact that reversible pulpitis, it's when the tooth becomes inflamed with the bacteria, which is caries. The black stuff that we see, it's bacteria that's eating away the hard surface of the tooth. So what we're saying is it ate up the upper part of the tooth. It's in the pulp, but it's at the beginning, meaning where we can clean up those black things, fill up the tooth, and that the tooth could be back to a restorative function, and it might not progress, meaning what we can actually try and stop or reverse the progression of the caries, which is the rotting of the tooth in this case. And the number of the teeth that are there that they were already marked there, already mentioned, is 2-8, which means is the second quadrant, 1-7, which is first quadrant, 3-8, which means the fourth quadrant, and then the 4-8, which means is of the fourth quadrant.
Lana ke esichazayo ke ukuthi ke lokhu bekuse kungabuyiselwa ke noma bekuse kungalungiseka ke ukuthi ke nanjengoba sibona ke ukuthi manje izinyo leli ke ibacteria leni isiyaqala ke ukulidla, kodwa ke ibisingakahambi kakhulu ke isengaphezulu ke kulona izinyo. So ukuthi ke bese ngathola ke ukuthi besingakwazi ke ukuthi ke sesingaklina ke manje lelo zinyo lelo, bese siyaphinda futhi siyalivala ke noma ke siyalifila ukuthi ke liphinde libuyeleke noma lokho kumnyama esekubonakalayo lapha sikhiphe, bese liyaphinda ke izinyo ke libuyela kwisimo salo. Abhaliwe ke lana ukuthi imaphi ke lawo mazinyo ekwatholakala ukuthi ke anayo inkinga, wabhale ngokwamanamba ke, kodwa lawo manamba ayachaza ukuthi yiliphi izinyo, u28, u17, u38 kanye no48.
And then from there also I've already indicated what interdental spaces means, or the spaces between teeth, the way in which the teeth are arranged inside the mouth. And I said the lower teeth have mild crowding. Mild crowding, we're talking about teeth that are not really straight, they are not really aligned. The other one is forward, the other one is at the back. So we're saying it's mild when the spacing in between, it's a certain length that we usually look for, the crowding that we look for. So in this case, it was mild, it was not really severe. So we just also marked those as well, and say the patient has mild crowding.
Bese sishilo ke noma bese ngishilo ke ngalamazinyo ke noma uthola ukuthi kokunama space akhona ke phakathi kwamazinyo, akusuka ukuthi amazinyo ke ahlangeneke, nokuthi ke kunaleya mild crowding engayichaza ukuthi ke uthola ukuthi elinye izinyo ke liye ngaphambili, elinye ke lihlehlele ngasemuva.
So, and also the final one that we usually stated here, it's I said it's partial endot. Endot, the partial endot, the endot just stands for edentulous, meaning that edentulous is a term that we use for patients that are missing certain tooth or they're missing teeth. So here we say it's partial because certain teeth are missing, not all of the teeth. If the patient didn't have teeth at all, we'll say the patient is edentulous, meaning they don't have any tooth. So we've stated it's partial, meaning there are certain things that are not there, which are the ones that the patient already stated that they have removed.
Bese kwatholakala futhi ke nokuthi ke kwakunamazinyo ke ayengekho bese shilo ke naye ke ngaphambi noma wayeshilo ke naye ngaphambilini ukuthi ke akhona amazinyo awakhipha.
And then we go to the treatment plan. The treatment plan is the things that we are going to offer for the patient to restore them to, let's say, the mouth being at maybe it's 80% close to 90% full capacity functional. So one of the things that's there, it's we say clean scaling and polishing. Scaling and polishing just means just cleaning the teeth, removing the plaque that's there so that the gums won't be affected. That's what's happening there. And then we also have oral hygiene instructions, which is what I touched on, saying or telling the patient, no, you need to brush twice a day. You need to stop using a harder brush, get a softer brush, and also orientating them on how they're supposed to brush, and also telling them that there is maybe a certain tooth that you need to give attention to when you're cleaning. Clean there more frequently to avoid certain plaque developing there. That's what's happening.
Kanye futhi ke lana ke bese kumnikeza manje ke iplan ke yokuthi ke kufanele ke awonakekele kanjani ke amazinyo akhe ke ukwapolisha ke kanye futhi ke nama instructions ukumchazela ukuthi manje ukuxubha ke kufanele kube usekuthi uxubha kanjani kabili ngelanga kanye futhi ke uma kuukuthi ke usebenzisa ibrush elikhunike uzama ukuthi uthole manje ke ibrush ethambile nokuthi futhi uma kukhona izinyo elithize ekufanele ukuthi ugxile kulona ke noma ke ulinakekele ukudlula amanye.
So, and then we say the other one, it's fluoride treatment. Fluoride treatment is whereby we actually just use fluoride, which is found in most toothpaste that we use. Whether it's Colgate, whether it's Aquafresh, there is a certain content inside. It's called fluoride. It strengthens the teeth. So after cleaning them, after giving the patient oral hygiene, we usually apply the gel inside a tray, and then we allow the patient to bite on it for about roughly 15 minutes to actually allow the opened gums and also the teeth that were recently cleaned for the fluoride to be actually roughly absorbed into it to protect the teeth that were actually more at risk of developing caries, to protect them from there.
Manje ke lana ikhuluma ke ngokubuyisela ke noma kwawo ke amazinyo kunento ebizwa ngokuthi ke ifluoride noma ke usebenzisa Aquafresh, usebenzisa iColgate ke ngaphakathi kuyona ke ine fluoride. Kunento ke engathi ke igel esithatha ke sithi ke umuntu ke akayi noma ke patient ke ayi ifake ngaphakathi noma ke ifake emlonyeni isikhathi esingangemizuzu ke ewu15 alumeke kuyona.
And then we were speaking of the restorations that needs to be done. The ones that we noted that were really severe, it was we need to replace, we need to make sure that the 17 and the 15, they're actually restored, because they were the ones that we would say the caries was moving progressively, that we need to restore in that terms. So we need to patch those teeth in a certain layman terms. And then the other thing that we also noted, it was that the patient will require orthodontic treatments to close the interdental space. It's an option of the patient if maybe they are bothered by the spaces that they have in between the teeth. If they want to close it, then we would roughly say, we recommend that they go and see an orthodontics, or they undergo an orthodontic treatment generally in any dentist that could perform, to just close the gaps. It's more of patient's appearance concern. It's nothing that's detrimental to the patient's oral function, unless if it's in a case whereby there is severe crowding, there are teeth that are misaligned, the patient can chew properly, then that's where we say orthodontic treatment is a need to arrange the teeth to its back
to its original standard familiarity that we know.
Bese kuba nalamazinyo amabili ke la engathi ke iwona ke bese ubuthola ke manje ukuthi iwona adleka kakhulu ke manje afuna futhi ke ukuthi ke anakekelwe ke abhalwe ngokwama number ke u15 kanye futhi no17 kanye ke nale treatment kuhamba ngokuthi ke kule treatment lena ke ibizwa ngokuthi orthodontic ukuthi ke i-patient lena ke iyamhlupha yini lento yokuthi kunamalama space akhona ke phakathi kwamazinyo indlela nje ke yokubukeka ke komuntu kodwa ke uma kuukuthi ke akusiyona ke into emhluphayo ke angayike kulokho kodwa uma kuyatholakala ukuthi ke kunenkinga khona ke amazinyweni mhlambe umuntu akakhona ukuthi ke angadla kahle alume kahle ahlafune kahle noma futhi indlela amazinyo amile ngayo ila sizosho khona ke ukuthi kunenkinga kufanele ayoyenza.
Then in conclusion, this is the treatment plan page. We allow the patient to actually sign, or say patient sign. And if you check, there is a signature for parent for in case if the patient is a minor, and also indicates the day in which it was signed, which is the 22nd of June 2020. So in conclusion, these are the exams that we perform on any general patient that we see, whether they have any conditions, they have whatsoever. It's a standard that we do in order to find the diagnosis for the patient that we have, and also the treatment plan, and also we write it out here. So usually, as you can see, the file was also, it ends up being stored and then it's kept in the database. Usually we always say the files are supposed to be kept there for at least more than give and take 20 years if since the patient has been examined. So they're supposed to be kept in the database. After 20 years, if the patient never returned to the institution, that's when most of the time they say that they do have the right to maybe take it and put it in somewhere in storage, but we keep them at the institution where we're operating because we have the belief that patients are supposed to come back for their regular dental checkups once every 6 months, if they can. So this is the standard form that we use.
Yona ke iform esisebenzisayo ikona lokho kwenzeka ke uma ubuka ke lapha ezansi ke ibhaliwe patient signature wase eyasign ke idate i22 zika June ngo2020 nendawo echazoyo ke ukuthi isignature yomzali uma kuukuthi ke le patient leyo ke umntwana ke osemncane ngokweminyaka ke iyagcinwa ke khona lapha ke kwi system noma ke kwindawo lena esebenzela kuyona ke iminyaka ke ewu20 uma ke kusuka ukuthi ke umuntu akatholakala noma akaphinde abuyeke kuleyo minyaka leyo ke isiyakhishwa ke igcina ke kwi storage ngoba ke okufanele ukuthi kwenzeka ukuthi ngo6 months kufanele ukuthi umuntu abe uyabuya ke azobhekwa ukuthi ke noma abhekise isimo sokuthi emuva kokuthi elashiwe ke lapha yana ukuthi inqubekela phambili ikanjani.
Now, doctor, do you remember what time you concluded the examination, or more or less how long the examination took?
More or less the duration of dental examination. We're just talking about the examination if we're not getting into the treatment. It's a patient in standard terms. They mustn't have less than 30 minutes with a doctor or a dentist, given if what we are looking for is specific. If a patient arrives and they're saying, well, I have a rotten tooth, and then you go through straight to it. When you check it, you see Urvela is rotten, you assess it, you percuss it, you realize, okay, it needs to be removed or it needs to be done root canal. That's when maybe the duration could be longer or it could be shorter in case of removing a tooth, because in most cases, if you find the source of the pain, you explain to the patient, and then that's the dental examination, not including the questionnaire. The questionnaire, it's a separate time. I would say we give it almost 15 to 20 minutes for doing the questionnaire, which is on the first page, finding out information from the patient. But when we're talking about the actual examination, when we start looking at the patient from the mouth, doing the palpation and whatsoever, it's supposed to be a standard of 30 minutes tops or more.
Lana ke uma kukhulunywa ngesikhathi ke akufanele ke kube ukuthi i-patient ke ichitha isikhathi esingaphansi kwayo ke i30 minutes kanye naye ke udokotela asikakhulumi ke ngale page eseqaleni ke la khona abuzwa khona imibuzo bese eyaphendula ke yona ke ungathi ke u15 ukuya ku20 minutes. Uma ke manje sesingena ke udabeni ila khona ke ungathi ke u30 minutes. Kuya ngokuthi ke yini efanele ukuthi ke yenziwe ke nalapho la kungandlula khona ke kuleyo 30 minutes loyo.
Now, doctor, do you confirm the correctness of your report?
Yeah, in terms of the way in which the report is being done, I would say I treated it as a standard case, and then I did given already there wasn't really much to really go on. I wouldn't say the patient has any severe dental related or any facial situations that I encountered. I would say it's kind of really standard examination, and this is how most of the patients that are close to fair to normal oral cavity examination is being done. This is the standard that we do, so I do confirm the practice.
Ngoba ke lana ngenzeka ke ngendlela ke esenza ngayo ke kubona ke ama patients ngako ke lokhu okuqulathiwe noma okukhona ke la kule document ke ngiyahambisana nako ukuthi kuyilona iqiniso.
Now, doctor, you testify that you examine a person from the waist up, you examine the head, you examine the oral cavity, you inspect the face, you look for lacerations, you examine the nose, and you also examine the neck.
Yes.
Is that right?
Ngishilo ke ukuthi ke ngambheka ke lo muntu ukhala ke enzansi ukhuphuka ke amakhala entanyeni ngambheka futhi ekhanda ngambheka ubuso ngishilo lokho ekuqaleni.
Now, allegations have been made that this patient was assaulted, was choked, was electrocuted some 3 days prior to your examination. Now, what would your comment be given your clinical examination and clinical findings?
In terms of assault, electrocution, since the patient was clothed, I'm going to conclude that when you look at a patient since he was clothed, unless if from our assessment, unless if the patient was being assessed maybe by a general practitioner or let me just say, we call them general practitioner or medical officer. That's when maybe underneath the clothes upper torso, they are allowed to take off their clothes. But from the appearance, what I could see from the patients, since the patient wasn't actually, in that day, I remember they were not wearing any jumpsuit overall. They were wearing their casual clothes, if I could remember. So from what I could see on the surface, not underneath the clothes, I didn't see any sign of electrocution unless if it happened underneath. As for choking, bruises on a person's neck, they can prolong, as we always say. It depends on the length and the pressure and the strength that the individual was pressing on the patient.
Lana ke kuzoba kuney'nsolo noma kuney'nsolo ezithi lo muntu lona ke washaywa, lo muntu lona ke banjwa ke ngogesi, futhi lo muntu lona futhi ke waqinywa ke. Thike mayiphendula ke lana ke ngoba wayegqokile ke ngaphandle kokuthi mhlambe wahlangana ke nodokotela ke yena ke wamcela ukuthi ke akakhipheke noma ke akhuphuleke ingubo le noma impahla lezi ayigqokile. Kodwa mina kulokho engangikubona ke akukangekho ke impawu eyishoyo ukuthi kwenzeka ke lokho. Futhi ke nokuthi umuntu aqinyweke khona la emqaleni ke kuye kuhambe ngokwesikhathi ukuthi lokho kwenzeka isikhathi esingakanani ke futhi kanye futhi ke nengcindezi eyabekwa ke noma ke ipressure eyafakwa ke lapho nkathi umuntu loyo eqinywa. Yes.
Markings of chokings, as we were taught, markings of chokings on an individual, they show in terms whereby it also relative to a patient's color. Dark people, if they are choked and they are pressed on the neck severely, it has to be at a certain severe point in order for the markings to show. But if it's a fairly light-skinned person, if you choke them or you just press their neck, there will probably be a depression if it was hard enough to lead to a patient gasping for air to a point whereby they will end up losing oxygenated blood supply to the brain. It will eventually show on the neck. And
Ngekwendlela ke esafundiswa noma esatshelwa ngayo ke kuya ngokuthi ke umuntu ke uyibala elinjani ke kulapho ke ongathi ke bona ke badakhe ke uma futhi umuntu ecindezelwe ke yena ke kodwa kulabo ke abakhanyayo ke kufanele ukuthi ke bona ke isikhathi ke esingakanani umuntu ke ecindezelwe noma ke ekhanywe ngoba lokho kubona ke kuzoba khona ke okubonakalayo kuyena.
So in this case, when you look at the patient, as far as choking marks, I was palpating the lymph nodes and checking the assessment, there were no prominent choking marks. But also, given that the assessment of the patient was 3 days later, it's been proven that even in normal terms, we call them hickeys, they call them love bites. They can persist for at least over a week if a patient was actually pressed, whereby a hickey is made in terms whereby if a person maybe was in a way in which were let's say in a sort of vacuum, or they were pressed. So they can last for about a week or so if they were done properly, or also if a person was choked and there's some depression marks.
But asibheke lana ke isikhathi ke ukuthi lo muntu ufike ke noma ke patient izile ke kwisikhathi seyinsuku noma amalanga ke amathathu ke futhi ke uma kuukuthi umuntu uqenyiweke noma lo abizi ke ukuthi ke ama-hickeys noma ke ama-love bites ayahlala ke emuntwini ke isikhathi esingangeviki.
So in this case, there were no certain marks that showed that maybe the patient was really choked. And as for the face, there were no lacerations, or also no markings that the patient was kind of really beaten up. It looked like it's a normal individual that doesn't look like they were in any severe physical altercation, unless if maybe the altercations were done anywhere else other than the face, from the neck upwards, and also other places that we couldn't see because the patient was clothed. But from my examination, what I've seen, the general appraisal of the patient didn't look like a patient was in any sort of state that they were done such things, unless if these things that were done on them, trauma to the soft tissue, especially on the body, was done in places that is underneath the clothes that I couldn't assess and see. But as far as the face go, the nose, the eyes, the way in which the neck was, and when you look at also the state of the teeth, it didn't look like this person was actually maybe severely beaten. It looks fairly normal.
Kulezi noma ke la engangibona khona mina kwakungekho nje okuyinkomba noma okushoyo ke ukuthi la ubuso intamo ke lokho engikubonayo ke ukuthi lo muntu lona ke khona la ekwangquzulwana khona ke noma ke ashaywa khona ke, ngaphandle kokuthi ke ungasho ke ukuthi lezi engayiboni indawo la awayegqoke khona ke noma la engangaboni khona ke, kodwa kulokhu mina engangikubona kwakungekho nje okuyinkomba nokushoyo ke ukuthi umuntu lona ke washaya.
Now, what was this patient posture when you were examining them? Did they show any signs of pain, any signs of discomfort?
They were coherent. They were talking. I remember since my Zulu was shaky, one of the assistants was the one who had to assist with the translation of the Zulu language, and they were speaking fluently. I think at some point the patient giggled. To me, it appeared as if it's a person who's more of worried than a person who's more of in distress of pain from the general perspective of view. And also the other thing that was also there is there couldn't be me further referring the patient to be assessed further on the body down, because from what I've seen, the patient really looked normal, and I wasn't indicated that the patient maybe probably is a trauma patient or whatsoever. I was given a fair chance by the police when they said just look for a certain thing. So when I decided to look for a certain thing, I think the patient has had a more fair chance of me not having a bias assessment of the patient, because I was looking for something and also checking other things. So meaning, or if I was persuaded and whatsoever, maybe my findings would have been maybe a bit more skeptical, but I was given a fair chance to examine the patient in a fair way.
Nganikwa-ke isikhathi-ke lana-ke ekuyisona-ke nesanele-ke ukuthi i-patient lena-ke ngiyibheke-ke ngiyilonga-ke futhi-ke ngendlela-ke ekuyiyona ngoba ukubuza ukuthi-ke ingabe mhlampe uma wawusebenza naye-ke usebenza ngaye-ke kwakhona yini la atshengisa khona-ke ukuthi khona la ezwa ubuhlungu khona-ke ukuthi cha lokho-ke akuzange kube khona-ke nokuthi futhi-ke inkinga yami kwakuwukuthi-ke isizulu sami-ke singekho kahle manje-ke lo owayengilekelela-ke uyena-ke ncedisa-ke noma engisiza ukuthi-ke angihumushele noma angitolikele-ke kuyena futhi-ke kube khona nala khona-ke ahleka khona-ke yona-ke i-patient lena-ke ngoba-ke ngatshelwa-ke uma elethwa-ke ukuthi angibhekeni ilokho-ke nami engakubheka-ke uma kwakuwukuthi-ke kwakukhona-ke okuwokunye mhlampe ngangizomdlulisela-ke kudokotela-ke okwakuyena owayezombheka kodwa-ke akukho nje okwakhona noma engakuthola ukuthi uney'nhlungu ayizwayo.
Did the patient tell you that he was assaulted? Did he make any assertion that he was
The
assaulted?
patient didn't state any sort of situation that maybe they feel they were assaulted in any way. They didn't. The only thing they stated from what we have from the report, it's them admitting that they probably had a heart condition, the mining accident that they had in 2014. In regards to that, they didn't state that.
Akashongo-ke kumina-ke ukuthi washaywa-ke noma khona la ashaywa khona-ke okuyikona nje angitshela kona-ke ilokhu okumayelana-ke nenhliziyo lena-ke noma isifongo lesi senhliziyo asithola-ke noma kade naso ngo-2014.
And finally, Doctor, you mentioned that if something is not within your scope, you refer it to the relevant discipline, for instance, severe injuries. Was there any referral in this particular instance?
In this particular order, I remember the whole event. Immediately after seeing the patient, they asked the warden and the police, or are we done? Is the patient supposed to see someone else? And the thing is, where we work, the patient can't pass through the medical side and goes through to the dental side without the medical people referring the patient that side. Meaning, when the patient, when they got there, they got to the reception area. A file was opened. Then when they took vitals, and then when they got there, when you take vitals, the nurses that take vitals, they also end up asking the patient, or are they specifically came for the dental side? And also, I think maybe in this case, they asked the police, they came to the dental side, or they're going straight to the medical if they have any part of their body that's undental, that's not dental related, that needs to be done.
Umshushu sifuna ukwazi ukuthi-ke uma ngabe usuqedile-ke naye ingabe kwakhona yini la kwakufanele umdlulisele khona-ke. Ngiyakhumbula-ke ukuthi-ke iphoyisa kanye nosojele-ke lona ababemphelekezela-ke bangibuza-ke ukuthi siqedile yini noma khona la ekufanele siye khona. Ngiphendula-ke udokotela uthi uma uza laphayana-ke kuthina-ke akukho la uzovele nje uze ngqo noma uzofika kumina-ke ungandlulanga e-reception, bona-ke onesi noma abahlengikazi-ke khona lapho-ke bazokubheka-ke futhi bakubuze-ke ukuthi uze kudokotela wamazinyo yini noma kukhona okuzele ongahlangene nomlomo noma amazinyo okumayela noma okuphathelene nomzimba.
So that, therefore, it means that the patient, when they came through to us, usually even if a patient, in cases where a patient has trauma cases, they first initially go through the state we're talking about. BPs are taken, they refer them to the emergency area, they check if blood pressure is stable, have they lost any blood, have they lost any fluids. When those are stable, they send them to our side due to the fact that they notice, or maybe the patient has some facial issues that are there, so we can assess them and make further referrals, meaning we'll probably have to send the patient to a maxillofacial, which is a specialist that deals with the neck, head up, in restoring it in severe trauma cases. So we, as IFIN, we are the last people that see in any healthcare situation. It doesn't matter if the patient was in an accident. If the patient was even in a car accident, they treat every single thing they check, and then they leave the part of the jaws that are broken, the teeth that are broken. Afterwards, when the patient is stable and the patient is coherent, it's fine. That's when they refer them to the dental side to have those treated, because we always say we start with the severe situation that are life-threatening. So if it was a case whereby maybe the patient, the jaw was broken and the tongue's position was shifted, it was swollen, it was going at the back of the throat, that's when maybe it will be referred to us, or we quickly need to take them to a maxillofacial so that that jaw gets rectified, so that the patient is not at life-threatening. But if it's not that case, when they come to us in treated state of certain things that they needed to have done in general of the body to us.
Thina ke sabogcita ke khona laphayana umuntu azofinyelela kubona ke ngaphandleni kokuthi ke mhlambi isimo njena ke sibucayi kakhulu ke la khona umuntu futhi ke masithi ke ulimi ke selihlehlele ngasemuva ke kufanele azoqala kuthina ke sibe sizamdlulisela silungise noma senze isiqiniseko sokuthi lapho ke usetholile ke usizo. Kodwa ke thina ke sabogcina umuntu eza ahlangana nabo ke ngoba kufanele konke kwenziwe laphayana ngaphambilini, babheke konke, babheke i-pressure ke yegazi, bambheke nje isimo sakhe ngaphambilini kokuthi ayofika thina.
Is there the standard procedure that you've just described?
The standard procedure that we had at the medical center, and is the standard procedure that in most cases they are supposed to be followed in any trauma individual case. The thing is, they go to an emergency room when they come for whatever trauma that has happened. They get assessed there for life-threatening conditions that are there, which we're talking about, or if they are bleeding severely, if there is the blood pressure is up, whether the patient is conscious, whether the patient can talk, whether the patient has those, they get assessed there, and they make the patient stable before they could go for any other discipline, which are called the rehabilitation part. We are part of the rehabilitation part. So if a patient comes straight to us, that means already the patient has no abnormalities that they could notice there. They're just sending them for normal dental assessment that we could do. Unless if it's in a case whereby it's in private, whereby a patient comes because they got assaulted in the face and they see a tooth is sticking at the back and their jaw is not sitting well, they will say, let me go and see a dentist to fix that. That's when they in private, that's when they get to me, I'll say, I can't touch this, I don't know what's really happening to you. I write a referral, I send you to a hospital.
Indlela ke ekwakwenziwa ngayo, indlela ke ekufanele ukuthi nabona ke kwenziwa noma ke izinto zihamba ngayo, ngaphandle kokuthi bona ke uma besemtholile bembonile ke babonile ukuthi asikho esinye isimo abamdlulisele kithina ke mina ke bese ngiyambheka ke uma ukuthi nami ngiyathola ke kukhona la ekufanele ngimdlulisele khona bese ngenza lokho.
So in other words, doctor, you're saying that a comprehensive medical assessment is performed on the patient. They take his vital signs, check for trauma. Thereafter, the patient is then referred to.
Yes, that's a part of the last part of the examination, which is most cases it's rehabilitation. Just as fixing what's broken regarding the patient's oral cavity or what we can't fix, then we send to someone who's related to us, working close proximity with us.
Thina ke sabogcina ekufanele silungiseke lokho kuyikona ekufanele sikulungisa uma kuwukuthi ke kuyinto ke esihlulayo ke ila esidlulisela khona.
Thank you, my lord. That will be all.
Yes, any cross-examination?
Sir, my lord. We proceed or adjourn, my lord.
Hello?
I was asking if are we adjourning or proceeding.
I don't know.
I only have one or two questions for the witness.
What's your time here? You understood, Jensen?
No. It's only one question or two, my lord. That's unless other colleagues are.
Your colleagues, anybody wants us to adjourn? Because he wants to prepare something or think about something.
I'm fine, my lord. You can proceed. Speaking for myself.
Okay, Mr. Ngomano.
We can proceed, my lord. Thank you.
Lord, I would ask that we take a short adjournment before we proceed with the cross-examinations.
Okay, how long?
10 minutes, man.
Are you not having lunch, this gentleman?
I think we can come back at about, let's put out 2 and then adjourn at 1.
What's the time? Who said the time is
23 minutes.
past?
23 minutes to 1.
I'm thinking about lunch. Don't they have lunch at 1 o'clock?
Yes, so we can resume at 1:45, then adjourn again at 1.
Oh, okay. We come back at 1.
I just want to establish whether what gave you or who gave you the power or the authority to examine accused number 2 in terms of general examination. Was it the consent, was it given to you by accused number 2?
When they came in, number one, they brought him in and then they explained to us what's happening, because it's the protocol that we follow when prisoners are coming through, that we need to speak to the police or the wardeners to find out what the patient is in for. And then from there, we speak to the patient and tell them, or we're going to examine you in relative to our standard. So it's up to the patient to say, okay, I want to be examined, or I don't want to be examined. So we do say to tell to the patient that we are going to examine you. The patient also has the right to say they don't want to be examined or not. But in this particular fashion, because they were brought by the police and the warden, when you look at it, I would say in any case, in scenario, since the patient was taken from a prison and was brought to us, it looks like maybe that's something that was maybe authorized by the law, authorized maybe by a higher order or whatsoever. And then, but when we convey to the patient, if the patient does continue agreeing for us to assess them, we take or the patient doesn't have any sort of issue with what we're doing.
Maqala ke babengena ke umuntu elethwe ke labo ke basejele kanye futhi ke namaphoyisa ke siqale sikhulume nabo ke sizwe kube yibona ke abasitshelayo, bese nathi ke siyayikhulumela ke naso isifoshwa ke leso simtshele ke ukuthi ke manje sesizobheka ke sesizophola ke kuba kuyena ke umuntu loyo ukuthi asho ukuthi cha angivumi ke ukuthi ningihloleke noma ngiyavuma. Kodwa ke naye unalo ilungelo noma uyalinikeza ilungelo lokuthi avumeke ukuthi singakwenza lokho noma cha. Futhi noma ubheka ke isimo ke noma ke kangendlela ke alethwa ngayo ke awazi ke noma ukuthi mhlambe kwakuyi instruction noma ke igunya ke elapho yake kwaba ngaphezulu ke lelo.
No, sir, I'm concerned about the privilege between the patient and the doctor. I cannot assume a privilege because, may I just establish, before you examine accused number 2, did you meet with the police first in the presence of Mr. Ntanzi?
The police, how it works in the system that we have patient queuing outside, in general as point of view. Né? Then when we have a patient queuing outside, patients come through with their line. We don't see any patient or talk to anyone prior to the patient actually entering into the exam room, because we're trying to avoid conflict of other patients coming in while we're still with other patients. So when the patient came in, when we started talking to the policeman, the patient was there. And there was no point whereby, I'm confirming there was no point whereby I was called into the corner and I was told directly when the patient was there. Maybe the patient, in my recollection, the patient was not sitting on the dental chair, was sitting in the chair that we usually put parents or guardians for minors to watch over their kids as we are going through operating them or we're examining them.
Engakusho ke lana ukuthi ke ngokwenjwayelo ke siba nabantu ke abazoma ke emgcini lapha abalinde ukuthi ke bangeneke ngoba sigwema ke into yokuthi usene patient ngaphakathi bese ngena enye ke. Kodwa lana ke okwenzeka ukuthi ke uma ngikhulumisana ke nephoyisa leli kanye nosojeleke, i-patient leyikhona ke ila, ngizama nje ukunikeza isiqinisekiso ke sokuthi akukhulunywanga nami noma angibizelwanga ekhonyeni kwakhulunywa nami, kodwa kwakhulunywa nami, i-patient ikhona. Kunesitulo ke esilaphayana esivamise ukuthi ke sihlale umzali uma kuukuthi ulethe umntwana omncane wayekhona elapho nkathi ngikhuluma nephoyisa.
So there's one answer that I asked from you, sir. Did Mr. Ntanzi give you a consent to examine him? Yes or no?
Consent in terms of them saying or we ask?
In terms of examining him?
Yes, we
ask. Did he give you the consent?
I would say we were given because we ask, the standard is we ask the patient
we tell the patient that what we're going to do, if they are comfortable with it, or we should go through with it. Before anything, in any standard, when we examine a patient, we tell them what we're going to do. Explain to you, I'm going to check you first, and I'm going to check for, I'm going to examine you, I'm going to check for any sort of deformities. Do you agree? That's standard. Do you agree? And then the patient, if they say they do agree, then that's when we proceed. Because a patient, any patient who's above, we say it's a minor if they're under 18. If they're above 18, it's considered an adult, they have the right to say no. So the patient did allow me to assess them. So in a way,
ngacela imvume wanginikeza imvume ngoba ke ngiyambuza ngiyamtshela futhi nokuthi ke yilokhu engizokwenza kuwena uyavuma noma yini ke ngoba lo muntu la sikhuluma ngomuntu ke ongaphezulu ko18 kuba ingane ke uma engaphansi kweminyaka ewu18 ukuphendula ke yebo wanginikeza ke imvume yokuthi ke ngaqhubeka ke.
Did you have a consent form that was signed by
the consent form
Yes.
that usually comes, ne? This is a file for the dental. When a patient comes in the I would have indicated that they should have gotten a standard form that they have. Remember the healthcare center, when the patient arrives, we have a file, a bigger file that comes in for us, whereby it has even things from the medical side.
I understand you want to explain. Did you have a consent form that was signed by Mr. Ntanzi?
The form, yes, we did have the file. In the file, there is a consent form that explains the patient agrees to be signed.
Are you in possession of the file?
I don't have the file.
Yebo ikhona ke iform ekhona uma sithola ke ifile la asayina khona.
Sorry, Mr.
Ngisho
Mgwezulu.
ifile anginayo.
You mustn't accuse me of giving evidence. Let's have a look at this. Because you are the ones who gave me this as an exhibit which was going to be utilized by Mr.
Yes,
Maloi.
I'm quite aware. For the witness did testify or the signature.
Yeah, well,
It talks about the signature here. It
you
talks
haven't
about.
read that. Let me read this. Let's bring it here. Oh, my God. Consent form. I, the undersigned, hereby give permission for dental treatment to be performed on myself, not my child. And then they say name. I have been informed and understand the benefits and burdens of the proposed treatment and treatment alternative and the option of no treatment. Then it's signed by somebody here.
The logic, my
No, it's okay. You
Yes,
can go on.
my logic, the logic that I'm trying to converse on there.
Okay.
The form was signed after the
No, fine.
examination.
Go on, Mr.
Yes.
Ngomezulu.
If it was signed before, or I'm putting to you that accused number 2, when he was brought by the police, he was in the car and he was under the guide, or he was escorted by certain metropolis officers. When the officers that spoke to you entered the searching,
I'm going to explain. When in the operation area that we work in, I only encounter with the patient when they have gone through certain people. Before they even get to me in the dental department, they need to go through our receptionist, the one who has a book that writes them down. And then they interact, whoever, if it's a guidance or whatsoever, they interact with them. When they come to me, I am only going to see the patient on the basis that they're going to just inform to me, or we have a patient. That day they told me, or there is a present patient, the policeman spoke to me, or you need to assess them. And then in most cases, I don't even ask for what it is for. I wait for them to come in and inquire with the people that are coming in, because most of our HR people don't really know what needs to be assessed from those patients. So most of them times they get the things wrong. So they always say there's a patient who's came in, especially patients that are from prison. Even when we were still in school, when we have patients that are coming from prison, they inform us when we have a patient, and then we speak to the policeman after, when they've already seen those HR people.
Say,
with the
lana
patient.
ke okwenzekayo ukuthi awumele uthi ke ummangalelo wesibili ke bayihlezi emotweni kanye ke namaphoyisa ke eMPD ngathi ke wena ukhulumisana nephoyisa likutshela ke laphayana uthi okwenzekayo ke ukuthi labantu laba baqala eHR HR lapha kunefomu ke ekufanele bayigcwalise bese beza kumina ke mabeza kumina ke futhi ke mina ngibona ke abangitshelayo ukuthi ke kufanele yini ke abeze ngayo noma abazoyenza.
During the examination in chief, you said the police officers informed you to check a specific thing.
When they arrived,
Yes.
initially with the accused, when they got into the waiting area, this is protocol that we do when it comes to prisoners or people that are being sent to us from a certain governmental institution. We need to talk to the person that brought in the prisoner and then ask them, what is the patient here for? And then they have to inform us what the patient did, confirm or they have a tooth that's broken, that's swallowed, and then from there on, that's when we proceed to talk to the patient. So now with me, the police corp just told me from their view that, look, we have a patient here, we have a case, we want you to either confirm if they had a gold tooth or they didn't have a gold tooth. So that's what I was told when the patient was there in the present. Then I continued to proceed to talk to the patient and telling them, oh no, what am I gonna do? I'm gonna actually examine you. So you're gonna sit down, I'm gonna examine you, I'm gonna examine the mouth, and also I'm gonna check certain things from you. And then the patient did say and agree, okay, no, it's fine, that you can do. And then I did do that.
Okwenzeka ke lana ukuthi yebo ke amaphoyisa ke elikhona elaphayana engitshela ke ukuthi yini ekwakufaneleke ngiyenze noma engiyibheke ke nokuthi ngenze isiqiniseko sokuthi wayenalo yini izinyo legolide noma cha i-patient ikhona ihlezi lapho emuva kwalokho ngase ngikhuluma naye ke ngimtshela ke ukuthi ngizokwenzani noma kwakuyini ke le engangizoyenza kuyena lokho kwenzeka ekhona.
Let me just put it this way to you so that you understand. In relation to the information you gave out as a doctor to examine the accused was not the scope upon which you were accused number 2 was brought to you. You exceeded the scope.
Remember in my explanation, when you look at the file, the form that we have, the standard, I was going through the file word to word, explaining every single thing that was there. And then if you could notice, every single thing that I spoke about, it's within this file. I never went above and beyond to write anything that was not within this file.
Ummeli uthi ke wena ke kulokho wakwenza wena ke wenza wase uyeqisa ke kulokho kwafanele ukuthi uyakwenza. Uma ubheka le form ke enginayo la phambi kwami eninayo ke nani ukuthi ke ngenza konke ngalendlela ekungayo la akukho la engabhala khona noma ke ngase ngengeza okunye okungekho kule form ephambi kwami.
You are not a pulmonologist.
That one, well, we are well aware, but remember, everyone.
You are not a pulmonologist, is that so?
Yes, I'm a dentist. Everyone that goes through medical school, we are supposed to learn the basic function of the body. Meaning, you have to be able to, when a patient arrives to you, know the most basic facts of every single thing that's been done. It's noticing the basic things. This is why we were taught in order to be able to identify if there is an assault patient that was, even if the patient, for example, even if a child is brought to me by their parent and saying, well, they fell, I'm supposed to, as an individual, look at the whatever it's been said is correlate with what the patient has said. If I see any marking that shows that the child is being abused, I'm supposed to, as an individual, address to that and then take steps, maybe in contacting a social worker or something that's that. So the reason why we are taught that, we're taught to notice bruises, to know the heart blood pressure of an individual, whether it's high, whether it's low, what does it indicate? And then based on that, we conclude whether the patient from our side, it's normal or it's not normal. That's why we check things like high blood pressure and these things, these readings, they are brought to us by the nurses that do these things and then they bring to us. For example, if a patient comes in with a high blood pressure into our waiting area, we're not going to see them. We're definitely going to write a referral and say, refer patient to emergency so that the blood pressure can be stable before we see them. That's the protocol, meaning that we need to know the basics about how the pulse is, how the high how the high blood is, how the sugar is, and also the whether the patient appears
Even
to
if
have
we were
any
taking
infection.
notes, we will not be able to take notes because just
I don't
My
understand. What are you saying?
my lord, I was saying even if we were taking notes and he's talking medical terms and whatever is quick and you can't follow him. So I want to confine him in terms of legal aspect. It's lunchtime. My lord, it's lunchtime. I thought I would have one question, but I see that there's so much to do now. May we adjourn, my lord, for lunch?
Okay. Hello, are you available after lunch, sir?
I think I was supposed to be available until 1:30 because there are some family responsibilities I need to attend.
Are you comfortable?
Huh?
Are you comfortable counseling them and testifying here, or do you want us to excuse you? Come on Monday.
I think already it's fine. I will just wait for 2 o'clock because on Monday I might not even be around.
Oh, okay, fine. 2 o'clock then.
cannot go straight up to treating a patient without asking any sort of medical history that's there. So what I did is we need to check the medical history of the individual before touching or even doing anything with them. We need to know whether they are sick with certain things. That's standard protocol in even any medical profession. Whether you are a dentist, whether you are an optometrist, you need to check that. So I did that. It's on record whereby I marked it and then the patient also signed. So from my recollection, I did that.
Ubongani Ntanzi uthi ke wena ke wambheka ke noma wamhlola ke umlomo kuphela awukazi umbuze ngesimo sakhe ke sokuthi ukanjani ke ngempilo lana kuthina ke awukwazi ke ukuthi ke noma uyiphi ke inhlobo kadokotela ukuthi ungavele uqonde nje odabeni nomuntu kufanele wazi ngomlando wakhe ke ukuthi ke ukanjani ke impilo yakhe akukho yini okumhluphayo ngenza lokho ke nami ilona le form leli eliphambi kwami.
Okay, regarding the HIV status, did you warn him that he's not obliged to divulge his medical?
As I stated when I was stating here that we ask the patient that do they know their HIV status? They said they are not aware. They don't know whether they are positive or negative. That's what we ask. We don't say whether the patient has the right. The question is, we don't say, are you HIV positive or are you HIV negative? We say, do you know? And if the patient decides to say, yes, I know, and then that's when we proceed to saying, then would you like to disclose? But if the patient just said they don't know, we're not gonna say what really happened. The further on, the things that we ask further on, it's, have you ever been tested? And then when the patient starts to say, no, I've never been tested, we leave it at that.
Mayelana ke nombuzo lona ke ophathelene nayo ke ingculaza ukuthi ke ingabe wami exwayisa yini ukuthi ke akaphoqelekile ukuthi aphendule. Lana ke wathi uma ngimbuza impendulo yakhe yathi cha angazi. Uma ethi ke angazi akukho ke okunye osungaphinde ukubuza. Kodwa ke uma impendulo yakhe kwakuwukuthi yebo ngiyazi, kula usomxwayisa khona ke manje ukuthi noma usho kuyena ke ukuthi ungathanda yini ukudalula ukuthi ke sithinike. Kodwa uma ethe nje cha akazi awukwazi ukuthi ungaqhubeka ngayo.
All right. Did you check him? Did you check COVID on him?
During the time they passed through the screening
process. Did you check COVID?
Listen, they pass through screening. As I've already mentioned, that the patients before they get to us, they go through number of exams. It was COVID times. They go through the reception, they see the nurses, they do the blood pressure, and then they also do COVID screening. And they do that at a separate location. When they come to us, it's a patient that's clear of the screening of COVID, and also with the HIV screen, they also do the same thing. They ask them if they want to test, they end up testing them. So those things, screenings are done by the nurses, which we say is the vital group that does that. So they screen them for that. So there is no patient who will pass the vital group, come to us with signs of COVID. So there are people who were at the time by the government appointed to screen any patient that comes through there for COVID before they even get to us. My point is the patient passed through a number of people before getting to me.
Ingabe ambheka yini ke umskrinyala yona ke iCovid uthi lokho kwenziwa ke uma bengena ke lapha yana ke akangeke ezofika kumina ke kungekabhekwa konke lokho baningi abantu abadlula kubona ke lapha yana la kwenziwa iscreen khona kubhekelwa yona ke iCovid ngoba ngaleso sikhathi vele ke kwakuyisikhathi seCovid nayo ke iHIV nayo ke uyabuzwa lapha yana uma kuukuthi umuntu nquma ukuthi ke attestwe ke nalapho kwenziwa khona lapho.
So was this form completed by yourself or by the nurse? The one that you were reading.
The form has two handwritings.
Yes.
The first one on top, if you notice where there's written vital, that's not my handwriting. You see, and you give any expert, handwriting expert, they will tell you there are two people who are writing here. The protocol is names, surnames, and including patients' contact details. They are done by the nurses there. And then the rest of the questionnaire, which is the questionnaire, the exam, the other part whereby we do the extra exams, it's done by us. So every detail that requires the patient's personal details and also the vitals, which I've already pointed out, if you can look at the form, that whether it's written BP inside here and also the time, it doesn't correlate with the other handwriting, which is mine. So meaning that this patient was seen and also the form was filled by the nurses. That's the protocol. They fill up the personal details. When they get to us, we only do the medical side.
Lana mubheka ke kule form lena ke ukuthi ke ama handwriting ahlukile ke lapha eqaleni lapha yana kubhala imininingwane yakhe, igama, iminyaka, kunama number, kunekheli, lokho ke kwagqaliswa amanesi lapho aqala khona. Ukuhlala ke enzansi la kubuzwa khona ke imibuzo noqhubeka ke neform I handwriting yami.
And it is, tell me, in terms of that form, where it is indicated that the results after you check the COVID were positive or negative?
I'm going back.
Sorry?
I'm going back to what I said initially. It's a dental form.
Yes.
When a patient comes to the healthcare center, there is a file that's in brown and it has lines, it has different disciplines inside. The form that I'm given here is for what I did. I did go through the rest of the form, and then the rest of the form is, when you go through them, you check whether the patient was screened for COVID or not, and then you send them back if they were not. We do receive it as a hard copy. Once we are done, we remove our part from the dental part. We store this part inside there. And most of the time when we store it, it's stored inside a system whereby it even has a correlating number with the actual document that's been kept by the medical side. This is done in order to avoid any complications between the dental side and the other side, because the patient might come back a week later with an appointment to us. We avoid the patient waiting in line again, trying to relocate file. Instead, the patient goes straight to us and then we retrieve this file.
Ingabe lana kule form kukhona la yini khona ke kushoyo ukuthi wabhekwa ke ebhekela yona ke iCovid. Ngizobuyela kamuva ke noma ngibuyele emuva ke la engishilo ke khona ukuthi ke kune file, sithola ke ifile, kuleyo file leyo ke kuneyinhlaka ezahlukeneke la echazwa khona ke ukuthi lokhu ubhekelwe nalokhu ubhekelwe, bese thina ke kuleyo file le uma seniqedile ngikhiphe eyethu ifile noma lena iform lena ngithi ibeke ecaleni la igcinwa khona ke, kwenzela ukuthi ke uma ngenzeke kule ipatient ibuye futhi ke kungabi ke nokunqobuzana ke la khona ke ezophinda futhi ayoma ke emgqeni kodwa ke lo muntu ebekade ekhona la.
The fact that I put it to you that you acted beyond the scope of the instruction, I'll just leave it for argument, but I'm just concerned about where you indicated that accused number 2 said he had a heart problem in 2014. It was an incident from the mine. And you further said that he did not take any medication in relation to that. When you were told, you said you were told by accused number 2 that he had a heart problem. Is that what you say? Were you told by accused number 2?
And then I'm going back to the form that I have. If you look at the form, the things that you're asking me, they're basically almost answered here. The health questionnaire asks if the patient had any sort of heart conditions or any sort of medication.
Yes.
So I need to ask those things. It's not beyond scope. It's beyond what the form.
The question is,
say.
Were you told by accused number 2?
Yes.
Yes, that's what I want.
Yebo ngatshela uye ke ukuthi wayenenkinga ke inhliziyo ekwenzeka ke emayini ngo2014.
My instruction is that accused number 2, where he was working, he's working underground. And no one can work underground. You can comment, you cannot comment, but this is what I'm putting to you as the instruction of accused number 2, is that if you have sicknesses or chronic illnesses, you cannot work because it's too hot underneath. Any person with medical defects cannot work there. So he denies having informed you that he had the medical.
Can I add? In regards to what you're saying, it's true. There's no denying in that. But also there is also a fact that most of the people that work underground, studies that's been there, and also if you look up through the internet, you'll find it. Most people that work underground, most of them, they are always checked through for if they have any sort of defect or whatsoever. But did you realize that there's a fact that if a patient has a high blood pressure, what the mines people do is they send the patient to a doctor so that they can have that rectified and managed before they go back underground. It depends on the severity of the situation. So in the terms of, that's now what I was informed, and that's what it came from him. That's what he said. So meaning that yes, he could have had a mining incident. We don't know whether it's minor, whether it's major, and then after a while, and then the patient was fine, and then they went back. So those things are the things that any logistics from the mine that we know, because when I was working that side, we used to have clients that they would basically almost, when I interacting with my colleagues, that they would come, they need to be checked, they need a medical certificate to show that whatever they had, it's not serious, they can go back underground and then work.
Yes. Wazi-ke ukuthi kwizimo-ke ekusetshenzwa ngaphansi kwazo emayini ukuthi-ke kuyashisa laphayana, angeke umuntu asebenzeke enesimo esenhliziyo. Kungayiqiniso-ke lokhu okushoyo, kodwa-ke kuyenzeka-ke futhi amahlandla amaningi futhi-ke lokhu-ke boniwe-ke noma ama-study akhona-ke ashoyo ukuthi abantu bayasebenza khona laphayana ezansi, kuya ngokuthi isimo siyalawuleka noma-ke sikanjani-ke. Abanye bayeza bazobona odokotela, umuntu azothi-ke ngicela nje incwadi-ke yokuthi nje babone ukuthi lapha manje isimo sami-ke sesiyalawuleka-ke, ngingabuyela ngaphansi. So kuya ngokuthi isimo leso sikanjani.
Yes. Let's get into the point where you say, when my colleague was asking you about assault or if somebody alleges that he was choked. According to you, are you in a better position to see if somebody has been subjected or he was choked? Because I don't want to, sorry, let me just clarify this one. Unless the instruction is that the accused was not strangled. I want to make a distinction between the two. He was not strangled. According to his version, a plastic bag was put over his head when he was choked. A plastic bag was used. Will you able to see if a patient come to you that this person was choked?
In a normal state, any patient that was choken with a plastic bag, unless if the only person that can be able to say the patient was choking in a plastic bag, in medical terms, from what I know, the only evidence that can show that a person was choked in a plastic bag and then actually there is a sign is if a patient succumb to whatever the plastic bag was. If they was choked and they end up passing away, that's when the autopsy from whoever's doing that, they'll be able to identify that. A choking of a plastic bag over the face, yes, ligature marks, if it was pulled hard here, there will be lines. Any plastic bag, if anyone, even right now, you take a bandage and you wrap it around your hand and you pull it quite very strong, it will leave a mark.
Uma-ke ukuthi-ke wafakwa-ke iplastiki-ke, lokho-ke la ekungathola noma kubonwe khona-ke ukuthi-ke masithi-ke umuntu-ke mhlampe usuyashona-ke ngenxa yalokho, uma sekwenziwa yona-ke i-postmortem kuzobonakala. Kodwa-ke uma kuwukuthi yona-ke leyo plastic iboshiwe-ke khona lana-ke yasiyaqiniswa-ke, kunama-mark ezowashiya. Ngisho nawe-ke uma ungathatha ibandage khona manje uyibophe khona la kuwena-ke kuzobonakala noma-ke khona lokho okuzosala.
Before you continue, let me add, in that term, means that even if there was a mark by a plastic bag, after 3 days later, when the patient came to me, that mark would have eventually been faded or have actually disappeared because of the fact that these marks that we were talking about, they are not severe marks that could last for long. Plastic bag doesn't have enough power compared to a rope.
Futhi-ke asithi-ke manje lo muntu uzile-ke useze emuva kwamalanga amathathu-ke lawo ma-marks lawo-ke kusengenzeka-ke ukuthi-ke enganyamalala-ke ngoba-ke i-plastic yona-ke ayifani-ke ama-mark ayo angeke ahlale-ke ngokufana nayo-ke intambo.
Yeah. All right, not at all, it's not his field. Before I just want to be straightforward. When you first saw accused number 2, Bongan Dance, he had no visible injuries. Did you see any visible injuries?
From my point of view,
Umbona kwami ke mina ke akukho kulimala okwakubonakala loba okwakucaceleke engakubona kuyena.
And you did not ask him to take out his clothes?
no, I never did that.
Angizange ngimcele nokuthi ke akhumuleke owayegqokile.
And tell me the time in which they arrived. And what was the time accused number 2 was brought to you? What exact time was it?
It was right precisely towards lunch. I think I remember it was towards maybe 1 o'clock. I think it was around 12.
Ngizothi ke ngaboma 12 ke kodwa nje ngaphambi kokuthi ke kushaye ihora ke lokuthi ke kube isidlo ke sasemini.
So that's when
Ukufika
you commenced your examination. 12 towards 1 o'clock.
Leso sikhathi ke ngaqala ngaso ke ukuthi ke ngimhloleke ngimvele.
In that documentation, it reflects 12:56. Is it that correct? Yeah?
12:52.
12:52. Beg your pardon. So what was the time you concluded your examination?
I would say maybe it's roughly maybe 30 or 45 minutes later because I remember it extended to lunch, then we went to lunch.
Ngizothi ke kwathatha ke isikhathi ngama 30 minutes kuya ku 40 minutes ngoba ngiyazi ukuthi ke kwathi ngidlulela isikhathi sethu ke se lunch sasithatha ke lunch.
Could it be 1:30?
I wouldn't be precisely sure.
No, could it be plus or minus, so approximately?
Approximately maybe.
Ngasho ke ukuthi labo kuma 1:30.
The last question is, let me just confirm if Thank you, sir. You said you graduated in 2019, if I heard you correctly.
Yebo ifundo zami ngayiphothula ngo2019.
So you conducted a community service.
Yes.
You started from 2020.
Umsebenzi wami ke usebenza emphakathini wona ngawuqala ngo2020 lokho besithe yiComsep.
Prior to the examination of accused number 2, you had 6 months doing a community service.
Yes.
Ngaphambi kokuthi ngisebenze ngaye ngisebenza noma ngihlangane naye ke uma ngalelo kwesibili ke nganginesikhathi singange 6 months ngiwenza umsebenzi.
Were you working under supervision
during my concept?
Yes.
Once immediately we work under supervision within the 3 years of our studies, but once you actually take oath, you are considered to be independent to work in a format whereby you work alone, but you have a superior supervisor that only in instances whereby there are complications that you also don't understand, you refer to them, complications.
Uma sesiqala nje kuminyaka yethu yoqala ke emithathu masiqala yila usebenza khona ke ubhekiwe noma ke kukhona ke umuntu okubhekile ke noma lokho kuthoke isupervisor ke kodwa ke uma usuqala ukuthatha isifungo noma usufunga ke yila ubonwa khona ke nanje komuntu oyimele kodwa ukhona ke ongaphezulu kwena ke uma kuukuthi kukhona ke okukudidayo bese kudlulisela kuloyo.
So you took an oath after 6 months?
No.
After you examined?
No.
Or before?
Take it before.
Sorry.
When you actually there are 2 different oaths that you take. You take an oath before you even start seeing patients when you're still in school, and there's another oath that you take to show that you are suitable and you have graduated and you have passed all the standard that the degree requires, and you are able to be on your own and you can supervise the person. Meaning within a year, I can be able to even supervise a person who's like a year behind.
Okwenzekayo ke lana ukuthi ke uma usufunga kufunga kabili ke khona la ufunga khona ke ngaphambilini uma kusesesikoleni ke ngaphambilini kokuthi ke ubheke ama patients bese kuthi emuva kwalokho ke yila ufunga khona ke ukuthi manje konke lokho izifundo lezi noma i-degree ekudingayo noma ekufunayo usundlulile kona waphasa-ke, futhi ngiyakwazi-ke ukuthi-ke emuva konyaka nami-ke sengingathi-ke ngibhekeke noma ngisupervise-ke omunye ongemuva kwami ngonyaka.
Have you encountered a situation where the police officers, you testify about prisoners that are brought to you, and you said in 2020 in June, have you encountered a situation where the police will confront you with the request of conducting a dental?
Remember in our year of studies, we are in Medunsa. Medunsa is one of the biggest oral health centers in Pretoria. So we used to always, there was a module that whereby anyone is supposed to at least have treated people that are from public, whether it's from prison and whatsoever. So we used to get maybe in a regular base, you used to see maybe, I would say 2 or 3 prisoners maybe in a month. So they used to always come, and when they come, the protocol is they come to you and then they explain what the patient is complaining about, and then you continue communicating with the patient regarding that. So yes, I have in more than one occasion.
Ngihlangeneke ngaphambilini-ke namaphoyisa-ke noma ngikhulumisana namaphoyisa, uzokhumbula-ke ukuthi besifunda khona eMedunsa yona-ke enkulu khona-ke ePretoria. Kuba khona-ke imodule noma izifundo-ke la khona-ke kufanele uhlangane nabantu bangaphandle. Kulabo bantu-ke bekuza futhi-ke iy'boshwa lezo-ke bese yilethwa amaphoyisa likutshela iphoyisa ukuthi-ke yini-ke isiboshwa esikhala ngayo, bese-ke ukhulumisana nesiboshwa emuva kwalokho.
I put it to you now, before I rest. I put it to you that on the day you conducted a general examination from accused number 2, you infringed upon his right to privacy. Especially, you breached the confidentiality of accused number 2 in relation to his medical status. What is the comment?
Now my question is, in which format? How did I do that? If this is, I'm saying if this is a form that's created by the state, which is the one that also everyone serves here, that we're supposed to question an individual who's coming to us and ask these questions, and we decide to ask them the way in which the form is decided, I'm basically saying it was me doing my job.
Uma uthi-ke angizange kwenze kahle-ke umsebenzi wami-ke, nokuthi futhi-ke amalungelo akhe-ke umsola-ke noma umangalo lwesibili-ke engingazange-ke ngenze ngokwendlela ngokuphathelene nawo-ke, usho kanjani-ke ngoba konke ngakwenza ngokwale ndlela-ke ekubhalwe ngayo kuyona le form. Imibuzo engiyibuzayo ngibuza yona imibuzo ekhona la ngenza umsebenzi wami.
Last question. You were asked by my colleague as to when you're conducting that examination, you said accused number 2, Pongantanzi, looked worried. What do you mean by that?
Worried meaning, or the patient, the facial expression, the way in which they were, he looked kind of concerned. I wouldn't say maybe it's they are stressed or whatsoever, but they looked confused. Worried meaning they look confused. They looked like, I don't know whether they don't understand the setting or what was happening, but that's a normal perception of any dental patient that's there. I tell you, any adult will tell you here that the moment they enter any dental practitioner's office, they start wondering what's going to happen next.
Lana engangikusho-ke ukuthi-ke manje ngikhulume ngegama-ke uWarid ngaphambilini ukuthi-ke bayibukeka-ke edidekile-ke ungathi-ke akazi-ke ukuthi-ke kwenzekani-ke lana. Ungabuza noma umuphi-ke kulaba abahlezi lana-ke ukuthi-ke noma umuphi-ke umuntu omdala uma engena-ke la ukuzothi kusetshenzwe khona noma ke akhishwe izinyo noma kwenzekeni-ke ila aqala khona-ke ukuthi manje sengasazi-ke ukuthi yini ezokwenzeka manje.
Say, on the form where it says complaint, main complaint, you see there? So it appears that it's written the patient requested. Can you read that for me, please?
It says the patient requested an examination for oral cavity.
What do you mean by that if you were approached by the police?
It means that I was informed what the patient is requiring to be done to them.
Lana ke engikufundayo ukuthi ke i-patient yase icela ke ukuthi ke kubhekwe noma kuhlolo ke la kuyena ke emlonyeni kusho ukuthi ke ilokhu engakutshelwa ukuthi yini leyo muntu ayizele.
So that is hearsay. We're not directly informed by accused number 2. You were informed.
I'm going to go back to protocol. We, as medical professions, is every single time whenever a prisoner, it's not the same as a normal individual. We are supposed to be protected by the people that come with the prisoner. So our interaction before we even go to the patient, with the patient being there, the policeman or the warden must be able to explain to us what we're supposed to do towards the patient, because that's for our safety. That's one of the things that's supposed to have been done there. Because if the prisoner comes in, the policeman goes outside, and then I engage with the patient there, we're not really sure what I'm actually the patient is there for. So we need briefing from the person who's bringing them. It's as if to us, it's as if it's a guardian. The patient who's bringing them, why are they the patient there in the first place? So that's why we're saying the main complaint is that.
Lana ke masikhuluma ngesiboshwa ke ukuzothi ke ukhona ke umehluko phakathi ke nomuntu ke oyibuyela nje emphakathini ke noma oyibuyela ekhaya oyihambelayo, ngoba lana ke kufanele siholwe yilo noma yila isiboshwa ayisihamba nabo beyibona ke abasichazelayo ukuthi uze ngani lo muntu lana, ngaphambi kokuthi singapho noma ukuthi iphoyisa liphume kusushiya uyasala ke nesiboshwa sona kube uyisona esikutshelayo uqala kulabo abahamba naye.
All right, there's one thing that I wanted to clarify before I step down. When accused number 2 was brought to you, was he brought to you by the members of the correctional services or by the police wearing civilian clothes?
There were my recollection of the people that day. There were men that were in uniform, brown uniform, of which from ever since we've been seeing prisoners, we know they come with that. They come with the prison orders, which identifies that. And there was another one who was not dressed in a brown uniform. So maybe I assume that could be the police corps, is that state.
Ma ke efika ke wayihamba ke nalabo basebenza ke ejele babegqoke ke uniform ebrown, bese kuba namunye ke noma abanye ke babengaqhokile iuniform bona engayicabangela ukuthi ngaba amaphoyisa noma iphoyisa.
According to his version, those people were not from correctional services. They were Metro Police officers from SWAT. Just to put it clear that accused number 2 was not brought from prison, but from police station.
So, but not from my recollection, I remember someone dressed in brown. I don't know what was really happening in that point of view, whether it's a correctional service. That's what I'm saying. From my knowledge, people dressed in brown are people from correctional services.
Angazi ukuthi ke babebuya ke kuma Metro Police, mina ke ngazi ngabona nje abantu ababegqoke ubrown, ngoba ke mina ngokwazi kwami ke uma begqoke ubrown ilabo abasebenzela correctional service.
Thank you, my lord. I have no further questions.
Yes, Mr. Misi.
I've got one question, 2 questions.
4.
Sorry. Thank you, sir. Thank you, Dr. Sokwe. When you're still a student at Medical University of South Africa, was Professor Mokokong still a vice chancellor and rector there?
No. At the time, there was a time whereby he had to resign. In the middle, at the beginning, yes, he was.
Yes.
In the middle, he had to resign. And then from there was De Beer, who came in.
No, don't worry about his successors. I just wanted to know whether at the time at which you studied there was he still a professor, and you just said no.
He was for the first year.
Oh, okay. In your pledging stages of your studies. Thank you. comprehensive medical assessment. Do you remember that word?
Yes.
Where did it come from?
It means a full.
No, I don't want you to give me a description or a definition of that word.
Or
Where
it means
did
a
that come from?
comprehensive,
Yes.
a fully clouded, a fully well done examination of an individual, given what you have in hand.
Uma ke kube ubhekwa lokho ke onakho ke noma obhekene nako phambi kwakho ke uma kuthethwa ke ngayo ke i comprehensive examination kusho ukuthi ke wenze konke noma wabheka konke.
Thank you, Doc. Listen carefully. Asking you, in the course of your testimony, where did that word come from? Comprehensive medical assessment. If you so remember, let me assist you. When the state was just about to close leading you, his examination in chief, he asked you whether, in terms of what you did, there was a comprehensive medical assessment, and then you said yes. Do you remember?
That was not a question.
Yeah, I can tell you what the
Question
question was.
There's a deception where they do a preliminary assessment.
Community
and-
service, is it?
And he also does.
Is that you're talking about, Mr. Minister, community service?
No, my lord.
Okay,
As I understood the state, I think that was the anti-penultimate question
Okay.
to the witness, where he says, would you then regard what you did, I'm just paraphrasing the
Okay, yeah,
state, would you regard what you did as a comprehensive medical assessment? And the doctor said yes. Probably the record can clarify that.
That's not what the witness said. Instead, asked him, he said there's a station at reception where they do a preliminary examination, and then the patient then comes to him, and instead then asks him, in light of the fact that the was this preliminary examination, and he also did an examination, so it was a comprehensive examination. That was the question.
My lord, I don't want to be unfair with the witness here. Otherwise, I'll be deviating from the oath that I take, that as I embark on this profession, I'll be here to assist the court at all costs. I am not so sure whether the court will be amenable to allow us the opportunity to go to the record. I mean, to listen to the tape recordings, just to clarify this issue, or just to put this issue at rest. Because I don't want to be unfair to this witness.
Counsel put his question to the witness can comment.
My lord, the state is in no way authorized to tell me how to conduct my cross-examination. Now he's objecting that what I'm putting to this witness is not what he said to this witness, and I heard him well. Now I say, let's go to the record, or to the transcript, or to the audio recording, and then you say I should continue putting my questions. What kind of a process is that? What kind of a procedure is this? Because by the very fact that he's objected to what I've said, he's basically insinuating that what I've put to this witness is not what he said. And that is exactly what he said. Now he says, let me continue with my question. And I'm saying to the court, out of respect for this witness, I don't want to proceed with a question that I'm putting to this witness that is disputed. Let us put this aspect of whether or not the state put to this witness that, would you then therefore say that based on what you did, that was a comprehensive medical assessment? That is just to paraphrase him. That should be beyond doubt before I proceed with this question.
Let me tell you, from what I was asked, I don't remember,
Yes.
and I don't recall when it says comprehensive. Remember comprehensive, you're gonna listen to me. Remember comprehensive, it's an examination that was done on an individual.
Understand me, say, understand me, understand me.
Sorry, Mr. Minister.
This word did not come from you, it came to the state, and then you concurred with the state that you did a comprehensive medical examination on the patient that you saw on that day. Now the state, as I'm repeating that question, then the state is saying, no, that is not what the state put to you. We are not part of the dispute. Let me assure you, we are not, you are not part of the list, the dispute. You see, the dispute is about me having understood the state
Sorry,
in
Mr.
different
Minister.
ways. I need paraphrase that and answer the question. Yes, madam.
Let's try and resolve this.
Yes.
Doctor, do you recall being asked the question as was relayed
What-
to you by?
What I recall,
Yeah,
I recall being asked
yeah.
if what, not from my mindset, if what I have said here or what I have written here, it's an honest and straightforward assessment of an individual. That's what I remember.
Engikhumbulayo-ke mina ngikubuzwa-ke lana ukuthi-ke kuyiqiniso yini lokhu ukuthi-ke i-assessment noma-ke ukubheka-ke noma-ke ukuhlola-ke umuntu engakwenza ngokukhumbula kwami. Ikona lokho engikukhumbula ngibuzwa umbuzo.
May we go to the record?
Yeah.
To the audio. Please record.
Okay, can you place the audio for us? When did
It was just what, I think it was his anti-penultimate question, last but two questions before he closed his cross-examination. I mean, his evidence.
Persistence is more towards the end, my
Yes.
lord, where
Before the
I asked-
cross-examination.
yes, or pre-examination, where I asked the witness, in light of the fact that the patient first had his vital signs taken at the reception, and he also did the examination, so it was a comprehensive. I'm the one who used the word.
Okay. Can you find that, sir? You have what? I can't hear. Oh, and the volume is low. Is that the place?
Maybe it should be go closer to the.
What's the score, Mr. Minister? 2-0. I say the score is 2-0.
It's not too nearly, madam. Actually, 10 not.
3-0.
10.
And you win.
Yes.
Okay.
Thank
Did you hear the translation? I mean the recording.
I could hear that, my lord, and I know exactly what I said.
Okay, fine. Continue, Mr.
As it is. Now, that which you are referring to as a comprehensive medical report is what is contained in this medical form here.
That's
My lord, that is not correct. That is not what I put to the witness who spent the whole afternoon until the cows come home. Let me once again try to clarify this. The witness said before the patient comes to him, he goes to reception, they take the vitals.
Objection, madam. Objection. He who testifies and needs to give answers to the question is the witness.
Yes, I'm raising objection, my lord. the witness mentioned that they also check for signs of trauma. And thereafter, the patient then comes to him and he does his examination. So the question was, in light of the fact that the patient first goes to reception, they take the vital signs, they check for trauma, then the patient comes to him, an inclusive examination. That is what was put to the witness.
Okay, I will check this later. But Mr. Nisi, you can cross-examine this witness on the basis of what you say you heard.
In the court.
Okay.
So that which you are referring back to my question, that which you are referring to as a comprehensive medical report is in essence what is contained in the form that you put this court through.
Let me answer you quite very correctly and clear before you go and twist.
Yes or no?
Listen, this is a comprehensive dental examination.
This is a comprehensive dental.
It's even written on the top
I
that this
can
is
see.
a dental services when it starts there.
Don't
Meaning
you-
that any dentist in any practice, in any government institution,
Yes.
they should have the standards of these things. These are the things that we are taught in
Yes.
order to go through for the patient.
Thank you.
And every line that everything I've said, I was going through all the lines that were here. I didn't drag something from somewhere and then bring it inside.
Thank you.
Lana mangikhuluma ke ngokuphelele noma ngokugcwele ngikhuluma ngako lokho okuphathelene nohlolo noma ke ukubhekwa ke ngokwa semlonyeni noma amazinyo ngoba ke kubhaliwe nala.
You were telling me that it is even written here. This is Jasishi. But I can see it clearly. It is written in the Tlhabane Community Health Center Dental Services. Thank you. Now, on what basis do you then say that what you did on the patient, I don't know who the patient was, but the patient that we saw on that day constituted a comprehensive medical assessment and not a comprehensive dental assessment?
I'm going to continue. I think in this case, I'm seeing it from my point of view. I was called in to talk about this. If you're going to talk about a comprehensive assessment, you guys should have went straight up to the healthcare center and got the whole file of the patient and then brought it here, and also with the medical examiners that were there and also the nurses that were there, because I'm part of a group. I'm alone. I can't say what the nurse did. I can't say what the doctor did. So in my turn, I'm telling the story that I saw, the story that I did on my own.
Thank you.
So meaning that me dragged into a corner of things that I'm not supposed to know, it's something else.
Lana ngikhuluma ngokwenziwa yimina ke noma lo okuphathelene nowami umsebenzi uma kwakuwukuthi ke kusekufunwa konke ke manje ngabe khanjiwe kwayiwa khona ke emtholampilo lapha yana kwase kuthathwa ifile leyana ke kwalethwa futhi nalabo abasebenza khona lapho kuleyo ngxenye leyo ke iyasemtholampilo nabo ke balethwe la ngingafakwa ke ekhoneni lezinto mina ke engazazi ngoba ke ngiyingxenye yeqembu.
No, nobody is trying to lead you into a snare. You're not being cornered here. It's just what you told the court. I am asking questions based on what you told the court. It is therefore an error to have told the court that what you did to the patient that you saw on that day, who is the subject of this hearing, and the reason why you're here today, it is therefore an error to have told the court that what you did on him was a comprehensive medical assessment. Because, as you say, you don't know what the others did. That's all.
In my response,
Yes. Respond.
I did say everything that I've said. What I'm trying to actually point out is
Yes.
it's on this document.
Yes.
Therefore, that means that I was just basically doing my job. That's what I was supposed to have done. And according to my scope,
Yes.
from where I know,
Yes.
comprehensive medical examination involving a patient as a dentist, it entitles this. That's what my job. I can't go and do what a doctor does if I'm not a doctor. These are the things that are supposed to. The file is saying everything. So I don't get where we are leading to.
Ukuthi ke uhole laphi uyakuphi nendawo angazi ke kodwa mina engikhuluma ngakho iloko ebhalwe lana ke ekuyikona ke ukuthi ke ikona okuphelele okugcwele engakwenza mayelana nalomsebenzi mina engikwenzayo angikwazi ke ukuthi ngikhulume noma ngisho okwenziwa udokotela mina engasiyena.
Doc, I'm going to implore you and plead with you to be very patient and be calm. And don't rush. Because in South Africa, there's no rush. The rush is in Russia where they rush. But what I'm putting it to you is that it is therefore a misnomer, an error to have told this court that what you did on the patient on that day was a comprehensive medical examination in instances where you only dealt with these patients on the question of the teeth. Not so.
So, God, please, now, the witness has repeatedly answered the question. Is there any point in repeating the same question?
Thank you, Madam. Let us proceed, sir. Now, what is contained in this form suggests that what you did can be referred to a comprehensive medical assessment. Now, you have said, and I'm not saying this is a comprehensive medical assessment, it's just a hypothetical situation. Now, you have said that when the patient arrived, actually your duties as a dentist, you start to treat the patient from his waist.
Assess, not treat. And treat the patient.
Assess. Yes.
Then let's get it right.
Assess. Yes. Assess. Just come down.
And the dictionary says assess is what you see, not examine. Those are two different types of examination.
Yes.
They are listed. There is inspection, assess. Assess is what you see.
Thank you for the lecture, sir. I think for the whole day you have given a lecture, but thank you. You said as a dentist, you assess a patient from the waist upwards. So, thank you. Now, you told the court, as per this form, that you checked his general appraisal. What did you say again? What is a general appraisal?
That's the way the assessment comes in. So that's where
What did you say is general appraisal?
General appraisal is
Yes.
the general look of a patient.
Thank you.
Ebengikusho ke la ukuthi ke uma umbheka ke ubuke nje ubone indlela abukeka ngayo.
You went on to tell the court that you also looked at his TW joints, his lymph nodes, his lips and buccal mucosa, his oropharynx and tonsils, floor of the mouth, the tongue, the gingival and periodontium, angle classification, teeth chart, and ultimately you did a teeth chart. That's all. Thank you. Now, the state says to you, did the patient tell you that he was assaulted? And what was your answer?
The patient never stated any assault. The only image that I was given, it was from the policeman that came in that we are looking for whether the patient had a gold tooth or not. I was assessing for that. And therefore, meaning when you assess for that, you need to state every question that's here. You need to state what it means and what it might indicate and what are the things when you say it's abnormal and it's normal. So I can't
Doctor.
state or it's normal and it's abnormal
Doctor.
without stating
Doctor,
what it is.
Doctor, can you please understand the question? The question that I'm posing is the state, now it's my colleague, the project tutor, says to you, ask you whether the patient told you whether he was assaulted. I'm asking you, what was your answer to his question?
My answer was simple. From me, from my assessment, I didn't see any sign that the patient was assaulted.
Hayibo.
Ubuziwe ke ngumshushisi lana ukuthi bakutshela yini ke ukuthi noma washo yini kuwe ukuthi washaywa yini. Yabe isithini ke impendulo yakho? Mina ke uma ngibuka ngimbheka ngabona ke ukuthi kwakungekho okushona noma ukuyinkomba ukuthi ke washaywa.
Is that what your answer was when the state asked you that question?
Is this a memory test? You know, the witness gives evidence in chief. If there's a question that my learned friend needs to ask, can he just maybe ask the witness? How is the witness now supposed to play his mind back? Remember each and every question that he was asked and what his answer was. We submit, Mama, that is not fair.
Yes, Mr. Mnisi.
There is nothing unfair with the question, man. I think just my colleague is a little bit reckless. Let me remind you, when my colleague, and I'm well within my rights to ask you to repeat the question that my colleague asked you. But this is what you told the court.
Can I say?
Listen, say, listen. This is not a circus. Listen. I am still speaking. This is not a circus.
Okay.
Yes. When my colleague said to you or asked you this question, whether or not the patient that you saw on that day told you that he was ever assaulted, your answer was, no, he never told me. Is that not what you said?
Isn't it same from my inspection and from what I was told? Isn't the same thing? Isn't assessment and also the question
that
I
not
never
what
the
you
question
said?
is there and okay, let me ask you, is there anything in here from this document that says I should ask a patient if they were assaulted?
You know, I seem to doubt your level of understanding what I'm saying, and basically it will go down to the level of you understanding me as a doctor. You know, I thought at some stage me and you being a doctor would be plus minus be on the same level of understanding each other. But the way in which your trajectory is proceeding, I seem to have a very serious problem. A very serious problem. You see. Thank you. What you told this court as the response to the question that my colleague asked you on whether or not the accused asked, that the patient that you saw on that day told you that he was assaulted, you specifically said, no, he never told me that he was assaulted. That is the answer that is on record. I am therefore basing the following question on that.
Okay.
Did you expect him? I'm not finished. I'm not finished. I'm not finished. I'm just pausing. Did you expect him to give you that answer when you did not ask him that question?
No.
No.
Lana ke umbuzo uthi ke ubuziwe ngumshushisi ukuthi wambuza yini noma ke wakutshela yini ukuthi lona ke washaywa ke wabe usuthi wena ke cha. Ingabe ke manje umbuzo olandelayo uthi uma kuukuthi wena ke awukazi umbuzo loyo mbuzo loyo wawulindele ukuthi akutshele yini? Cha.
Thank you. Did it ever occur in your mind that you should ever ask him whether he was assaulted?
I'm not supposed to ask if a patient is assaulted or not. That's a medical officer's way of doing. I'm supposed to be able to identify if there are any signs and then report them. Those are quite very different things.
Mina ke okwami asikuthi ke kufanele mina ngimbuze ukuthi washaywa yini ke ukhona ke udokotela osebenza ngalokho ongakwenza lokho. Okwami ukuthi ngibheke nje ukuthi ikhona yini impawu ekhona ke noma inkomba yini ekhona ubese uma ukuthi ngiyathola bese ngiyakureport ke lokho.
Thank you. Now, in terms of your assessment, examination of the patient, on the basis of what you've just said now, you assessed him and found that you could not find a possible sign that suggests that he was assaulted. Not so.
Exactly my point.
Ngishilo ukuthi akukho engakubona okwakungasho ukuthi washaywa.
Thank you. In your examination of the patient, on the notion that this was a comprehensive medical examination, did you check his eyes? Yes or no?
I go back to the file.
Yes.
I was saying everything that was on the file.
Yes.
Ngibuyela futhi ukuthi ngawabheka amehlo akhe ngibuyela futhi ke kufile lena la ngisho konke okukhona noma ke okubhaliwe khona la.
Did you check his how do you look? Did you check his ears?
I go back to the file.
Yes.
Wayibheka yini indlebe zakhe ngibuyela futhi ke kuyona ifile.
Did you check his nostrils?
That's a general. I did say, I explained right now, or one of the signs that's there, that when you assess, you check the mouth area and also you check the nose, or whether there is any deformity. I'm not eligible to open the patient's nose and check whether there is something inside it whatsoever. I'm checking the general appraisal. I didn't speak of that.
Thank you.
Okwami ke bese ngishilo ngaphambili ukuthi ke ngiyawubheka ke umlomo, ngiyabheka ke ikhala, hayi ukuthi ke ngibheka ngaphakathi ukuthi kunani ngaphakathi, kodwa ukubheka nje ukuthi kuloko engikubonayo ngibonani.
Would you dispute it if I were to say to you, had you gone an extra mile, and I know that was not your area of operation, but had you gone an extra mile to check his eyes, or maybe to examine his eyes, if I may put it like that, and probably to examine his ears, there could have been possible signs that would have led you to conclude that something had happened to this gentleman. Would you dispute that?
Examination of the eyes is done by an optometrist.
That I understand.
For the ear, it's
That
done
I
by
know.
an audiologist.
Thank you.
So if I'm going the extra mile, I will be doing what's not within my scope.
Thank you. That I understand.
Ukhona udokotela wamehlo, ukhona udokotela wendlebe. Uma ke mina ngandlulela kulokho ke ngizoba ngenza engafanele ukuthi ngikwenze.
So as a result, I cannot say I would have been able to confirm or deny those things, because that's not my job.
Angeke ngisho ke ukuthi ke ngangizobona ke ukuthi ngempela khona kwenzeka ngoba akusiwona umsebenzi wami.
It's the same as asking a carpenter to check whether a car has an oil leak or not.
Oh, you're a carpenter.
I know, I'm asking.
Oh,
It's the same as that.
okay.
Kufana nje ukuthi ke uthi ke carpenter ayibheke ukuthi imoto ingabe ivuza uwoyela yini.
Okay, thank you, sir. Thank you. With the carpenter example. Do you then realize that the fact that you told this court that on your examination, you could not detect whether or not the patient that you see on that day was assaulted? That conclusion is based on a very light and a what do they call it now?
A cursory.
A cursory, yes. A cursory examination of what you did on that day.
I was here.
Do you understand the term cursory? It means very light. It's
Yeah.
Yeah.
Listen,
Yeah.
I was not here
Yeah.
to actually confirm
Yes.
or make sure whether the patient was was traumatized or whatsoever. I was here
Yes.
to read the thing that I filled up, the document that I had in my position.
Thank you, sir.
That's what I was here for.
Thank you, sir.
Engikuzeleke lana mina-ke bekuwukuthi nje ngizofunda-ke noma ngisho lokho engakwenza lokho kwenzeka ngaleliya langa.
So basically, that is the information that now you're directing to the state, that you were not called upon here to come and state whether or not that the patient that you saw on that day was assaulted. Is that a message that you now?
Message I'm delivering is yes, as I took oath.
Thank you.
Whenever I'm required
Yeah.
to come and explain what I have done, I'm supposed to come in front of the court or anywhere when I'm required to say what I have done. That's what I'm actually referring to. So that I'm not here to confirm whether the patient has gone through any trauma. I'm supposed to say from what I've seen, my examination, what does it say to everyone who sees the page? Does it say the patient was traumatized or the patient had any sort of lesions or the patient has any sort of disease?
Yes.
That's basically what I'm here for.
Engikuzeleke lapha mina-ke ukuthi nje lokho engakubona ngangibuka kuyena ngase ngakubona mina-ke nokuthi-ke ngizosho kona-ke la.
So you're basically saying you can't tell whether the patient was assaulted or not. The patient that you saw on that day.
You can, at certain instances, at certain severities, whereby it's there through what we are taught to assess and certain conditions. The file, as it was saying, when you go through the clinical examinations, this is the parts of the things that we're saying, or to a general dentist, if a patient was assaulted, to a certain extent, you can be able to. I did mention that if a patient, yes, they were actually assaulted, they were bruised, they had a blue eye, or maybe they were busy choked, or there was any sort of trauma that happened to them. Due to the form, the way in which it is, I could be able to detect or there are bruises where and where due to the form that I have. Meaning, or yes, a person can go an extra mile because this is what we call in medical term, there is internal damage for an individual. Meaning, or a patient can appear to you right now saying, or they have a head that's bleeding inside a teared vessel, but you can't even tell it because when you can't see it, but there's someone specific who's supposed to go an extra mile and check that. So I was not supposed to go an extra mile. I was supposed to do what's on the file. I did that. I said that. That was my job.
My question.
Mina-ke okwami kwangasukuthi-ke ngeqe-ke ngidlulisele-ke kulokho ekufanele ngikwenze, kodwa-ke lokhu okukhona-ke okubhaliwe khona lana-ke uma kuwukuthi umuntu uyakutshela-ke ukuthi-ke lana mina-ke ngilimele ekhanda kodwa kuyakubonakala ngilimele ngaphakathi, ukhona umuntu owenzayo loyo msebenzi loyo.
So because you are not that person, you therefore can't say, you can't really dispute as a matter of fact that the patient that you saw on that day, prior to you seeing him, he has been pummeled into a moral of bitterness. He was assaulted. You can't dispute that.
Maybe you didn't actually really understand maybe what I had narrated to you. Let me rebrief again. Understand here. There is a certain extent whereby you can be able to identify such things, but there are some extent that you can't. That's why whenever a patient comes and complains of clinical signs of being, even to a general doctor, they might send them to an RMS scan, send them to an X-ray to do further investigation that they couldn't see with the naked eye. So now from what I've seen, I was told that I'm looking for whether there's a chip tooth that gold came out from, and then I assessed that in general, and then I also checked everything that's there from what I know, from what's within this file. It says, from what this file says in conclusion, it says, from my knowledge due to the file that was created by the state, which is allowed to be practiced in Northwest, in that tribunal district, I didn't see any signs from what I have seen. That's what I can be able to say. Saying, or I can say, if I had gone an extra mile, saying, or if I had, I can conclude and I can say, I'm saying, yes, I can conclude to a certain extent, not further and beyond. Certain things will have needed to be further examined further on. But to my extent, that's what I could see. So that means from what I could see, that's what's there on the file.
Mina ke ngiyabheka ngibuka ke ngisebenza ngalokho engikubonayo ukuthi zikhona ke izimo la khona ke ungathi ungabona ke ezinye ke ungaboni ke umuntu kufanele andluliselwe ke noma umunye udokotela ngeke akubone lokho ngeso lenyama kodwa kuzofanele umuntu adluliselwe ke kuma scan. Mina ke ngenza lokho ke ngoba le form eyaphushwa uhulumeni wakhona ke eNorthwest ngasebenza ngokwendlela iform engiholela ngayo ukuthi ngenze ngakhona.
Sir, did you understand my question?
You also didn't understand my answer, maybe. Your question was, can I conclusively? Can I conclusively?
Sir, Mr. Mnisi, now
did you understand my question?
No, just wait. We are now involved in a debate with the witness. Just put to the witness what your instructions are.
Thank you.
Or what you logically think.
Thank you, madam.
He can conclude having done what he calls a comprehensive assessment.
Thank you, madam.
Otherwise, we'll be here.
Yes.
Until.
Thank you, madam. Let me spare you the agony, sir. I am putting to you that with the little assessment that you did on the patient on the 22nd of June 2020, you are in no way, you were not actually positioned to come and tell this court emphatically, or as a matter of effect, that the patient that you saw on that day, prior to him coming to you, was assaulted. Do you have any comment?
No, I don't have any comment.
Thank you.
Mina ke ngithi kuwena ke ngohlolo ke owalenza ke noma ngendlela ke owamxolo ngayo ke awukho isimo ke sokuthi ungaza ke kulenkantolo uzoyitshela ke ngempela ke ukuthi cha akazange ke ashaywe futhi cha akukho engakusho.
Thank you, sir. Sir, let me spare you the agony. That would have been my last question to you. Thank you.
Yes, Mr. Romano.
I think, my lord, I have no questions to the witness.
Lord, I see it's 25 past now.
Now we're going to finish with this witness today. We must sit until 9 o'clock. So be it, please.
Thank you. Sir, doctor. The document that is in front of you, if you can assist me, what do we call it? The one that we have been testifying about.
It's a comprehensive dental exam. Dental exam. Any dentist must be able to. This is what a comprehensive dental exam is.
Lana ke kusho ukuthi ke noma ufike udokotela ke osebenza ke ngamazinyo ke lona ke uhlolo ke okuphelele okugcwele kwawo amazinyo.
Is it a report or it's the recording? What is it?
It's a file whereby you assess, and then from what you have assessed, you write down and then you report. It's even stated here, it says progress report, notes, and treatment that's supposed to be done through the patient.
Ubhaliwe ke nalana ke ukuthi i-report ke noma umbiko ke mayelana nayo ke i-patient.
In other words, you are saying this is a report. Am I correct?
I'm saying it's a dental exam. A dental exam includes findings and report and treatment of what the things that you have seen.
Okay.
It's an examination form.
Ifomu ke lena lana khona ke i-patient ke lana ihlole khona ke ifaka phakathi ke kunombiko nokuthi futhi ke yini ke oyenzile ke kuyona ke i-patient leyo.
Okay. So, according to you, this form, in this form, you will record every examination that you conducted to that particular patient? In this case, we're talking about accused number 2.
This is the guideline that we use, yes, from the standard guideline that we use to record everything that I have seen from the patient or I have noticed abnormal or normal stuff. That's there.
Lana ke ikona ke obungiholayo ukuthi yini engiyibonileke kuyona ke i-patient okungendlela noma lokho ekungekho ngendlela noma ngesimo esifanelekile.
You testified in your examination in chief that you examined the upper part of the body of the accused.
I not examined, I said the same thing to him, inspect.
Yeah. Whichever, you can give us another terminology, but that's what you did.
Those are two different. Examining means palpating, checking bloods, doing other things. That's a full inspecting. It's what you see. It's what you just have seen.
Okay.
Lana mina ke engakwenza ukuthi nje ngiya ngalokho engikubonile noma engakubona hayi ukuthi ngase ngena ke ngenza umsebenzi ke ngibheke igazi nokunye.
Is it recorded here in your report? Maybe I missed it. Is it recorded in this document that you inspected the patient who was in front of you? This is what you discovered. Is it recorded in this document?
On extraoral examination, it says general appraisal, which involves what you have seen in general. If it's abnormal, I would have ticked abnormal. I ticked normal, meaning that I check the general appraisal of the patient, the way in which the patient is standing, the way in which the patient looks, and the way in which the patient might appear to have any sort of normal abnormalities from the normal individual human being.
Lana ke kubhaliwe ke ukuthi ke nanjengoba yila engithika khona ke ukuthi normal noma ke abnormal yiloko engikubonayo mina uma ngimbhekile ke bese ngiyathika ke.
From your observation on the upper body of the accused, you did not ask him to take out his clothes.
Is that correct? In the recording, as he likes referring, that it's not my job to ask a patient to take off their clothes, and then also.
Objection, but actually I'm getting a little bit. I don't want to lose my patience, but gentleman then, he's a doctor, I respect him. He does not have to sound sarcastic when he's answering the question. So you don't have to point at me and say, I kept on referring to him, I kept on referring to him. To him, I am not him. Actually, to him, I am fair. I am an advocate of this matter. I am going to request the court to respectfully request this witness to answer the question directly and to avoid to sarcastically keep on defending. I'm taking a very great offense.
Mr. Flora, can you continue, please?
Thank you. Furthermore, in your testimony, you were asked about the injuries, if the accused had injuries on his face. You remember that part of the...
Yes, I do.
Yes. And you said there were no injuries on his face that you noted or you observed.
That I observed.
Yes. How many patients did you examine on this particular day? Or did you see on this particular day?
We were working, 3 of us that day. We have 2 operating areas. We alternate. There will be the first person, 2 people that come
How
in.
many? How many patients?
How many patients?
Did you see?
I can't really recall how many patients I could.
Okay. It's fine. And you did not record in this document that you observed the face of accused number 2 and there were no injuries.
Because there is no question in the file that says I should have recorded that. I was recording what I've seen. As he was, sorry for saying that, as it's already been said, that when you look at everything that I've gone through here, is the things that I was supposed to have been done. So meaning already the general appraiser, if I did notice that there's something even a significant trauma to the face and whatsoever. A probabilistic abnormal and right, or there is a bit of a scar on the left and there is whatsoever. As if I've already indicated when it comes to the other parts of gingival, I have noted already. Okay, it's abnormal, then there's supposed to be this.
Okay, doctor, don't be long, doctor. We are doctor by profession, am I correct?
Yes.
The witness is trying to explain now. Counsel is raising her voice and interrupting the witness. We submit that that's pressuring the witness. The witness should be allowed to respond to a question.
Yes.
Thank you, my lord. I'm on the injuries. I'm on the evidence, part of the evidence when you said you did not see, you did not record any injuries. And I've asked you how many patients you treated on that particular day. You said you cannot recall. Okay, then my next question is, how do you recall that the accused did not have any injuries on the face if you cannot be able to recall the number of the patients you treated on that day?
And I'm going to go back and then I'm going to say this. That side, we barely see any sight of anyone in handcuffs or any sort of prisoner that was there. So on that day, specifically on that day, he was the only prisoner I've ever seen. Meaning that whatever was really happening there, anyone who has experienced one moment in a very long time of something that they never seen before, you can basically do recall. He was not a normal patient.
Okay.
That was the thing.
Can you allow interpretation, doctor?
Wazi kanjani ke uma kuwukuthi awusakhumbuli noma ukuthi bangaki ke ama patient owababona lapha ukuthi yena ke wayengalimele ebusweni, yena ke isona kuphela isiboshwa engasibona ngaleli langa, futhi ke kule ndawo esebenzela kuyona nje akusiyona ke into evamile noma ejwayelekile ukuthi nje sihlanganeke noma kuze iziboshwa ukuthi nake manje ke leso sigamo ke sodwa esenzeka ke isona ke esingabangela nje sona nje sisodwa ukuthi ke ukhumbule.
You know, doctor, with due respect, the fact that you did not record that in this document, that you inspected or you observed, whatever the way you did, but you found that there were no injuries from the accused face, that finding or whatever, you should have recorded it here. In the absence of that finding, which is recorded here, it means that we are fabricating the story today. You never observed the accused on that particular day, his face.
The witness has already answered that. We submit that there's no need to repeat the question.
Yes.
Thank you, my lord. It's on record, my lord. Thank you. And secondly, Doctor, whilst I'm still on in the observation of the injuries, are you a district surgeon?
District
surgeon. Or do you work as a district surgeon as well?
We submit that question. Proper, the witness said he's a dentist. That's his area of expertise.
My lord, I know the witness said is a dentist, but I know where I'm going to, my lord, because I'm cross-examining on the observations is in respect of injuries when he is a dentist, my lord.
Yeah, but you just have to put it that because you're a dentist and you're not a general practitioner, you are not able to comment, like Mr. Mnisi was saying. Otherwise, you know what?
Can I rephrase?
Wait. One time, after this trial is long over, when we all have gained experience, you must listen to how this cross-examination is conducted. You must listen to the answers. You'll realize that maybe if you have posed these questions in another way. Here you can see we're just debating with this gentleman. He says this is what he didn't observe. If you put it to him that is incorrect because he doesn't have the qualification like Mr. Mnisi has done, that takes care of the thing. And then you can come and argue. But now we are denigrating each other. You're not a district surgeon. You're not this, you're not that. It doesn't help me to solve this case because I'm going to solve this case on the basis of whether the state has proved beyond a reasonable doubt that the confessions were made voluntarily or freely, or I'm going to find that maybe the opposite based on the evidence. But this to and froing about this document, I don't think it helps this court, because the gravamen of the criticism which Mr. Mnisi puts to this witness is basically saying the court should not accept the observations proffered by this witness. Beyond that, whether he served 6 months comprehensive training, how many patients has he seen, difference between an assessment and an examination. It's a debating school. That's what we are on. Because the law is clear. If there's an allegation which has been put by the state, bring evidence and rebut it. Or when you cross-examine this witness, you can put it to him that he's fabricating, as you say, because he doesn't have the expertise to have made that assessment. And then we go forward. Okay.
Thank you, my lord. Can I proceed?
Yes.
Thank you. Thank you, my lord. Sir, do you know a form that is called a J88? It's a medical report. J88.
Yes.
Do you know it?
Yes. Ngiyazi ke iform lena ke esetshenziswa ngayo ke ngodokotela abayibiza ngokuthi ke i-J88.
Do you know that that is the form that is used by a district surgeon when he is conducting examination to a person?
I do. Ngiyazi ke nokuthi futhi iform ke esetshenziswa uyena ke udokotela uma ke esebenza nomuntu.
And in that form, the doctor will record the injuries or the condition of the person that he examined on that particular day. Am I correct?
I do.
Yes.
Ngiyazi ke noma futhi ukuthi ke ubhalani ke kena ke udokotela.
And in this is not a prescribed form that is used to record the injuries observed by the doctor when he's examining a patient. You agree with me?
I agree.
Thank you.
Ngiyavuma ke uma usithi akusiyona ke iform lena ke ekuyiyona ke efanele ukuthi yasetshenziswa ke uma kuwukuthi udokotela ke ubheka umuntu noma uhlola umuntu.
And also, let's go to the page number 4, wherein there is a consent form. Consent part at the bottom there. You see that form, that part. Were you present when this document was, this portion was completed?
The handwriting on the date, it was mine. So yes, I was present in the date.
Okay.
Ngathi ke i-patient sign lapha yebo ngangikhona ngoba ke la ekubhalwe khona i-date mina owabhala i-date.
When the signature affixed there was appended, were you present?
Yes, I was.
Ngangikhona uma e-signed.
Who signed that?
The patient signed.
I-patient ke ukwazi kwami ke iyona e-assigned lapha yana.
On the first page, where it says patient signatures information, who signed that?
Also is the patient.
Nala page yokuqala ke nalapho yena wasayina.
Were you present?
Yes, I was.
Yebo
handwriting on the date.
Ngangikhona nalapho bhalwe khona i-date mina wayibhala.
Did you explain specifically to the accused what is it that he was signing here?
Fully, we're supposed to do that. That's part of the job.
Ngokuphelele futhi ngamchazela ke ukuthi uma sign usayindelani ngoba ingxenye yomsebenzi leyo.
In what language did you explain?
I used English.
Ngangisebenzisa ke i-English noma ke ulimi engangilisebenzisa kwakho i-English.
Did you ask the accused if he understood English?
At the beginning, when we were busy assessing the patient, I asked, there was, as I already stated, when I was speaking here, that there was an assistant, because my Zulu is not proper, that was helping with the Zulu. I used to ask the questions in English, and then there was an interpreter of an assistant that explained these things to the patient.
Ngabe wambuza yini umangalela ukuthi ke isiZulu uyasizwa yini? Bengishilo ke ngaphambilini uma ngikhuluma lana ukuthi ke isiZulu sami ke asikho kahle kodwa ke lona engangisebenza naye engilekelela ke uyena ke owayengisiza ke ngokuthi ke ahumusheke ngesizulu.
But when this consent part was completed, the interpreter was no longer there. You yourself who
No,
interpreted.
they were there. It's an assistant. The assistant remained there throughout. They don't leave. I leave before them. They have to supposed to give patients instructions of whether if it's something that's supposed to do and whatsoever, and also dismissing the patient. Then I
Thank you,
move
my
to
lord.
the
I've
next.
got no further
Okusho ukuthi ke nkathi ke lengxenye ke iyona ke ihunishwa noma ke isayindwa ke wayesephumileke lo wayetoleka cha abahambi baba lapha yana isikhathi sonke imina engihamba kuqala kunabo ngoba bona bafanele bachazeleke ama patient okunye okufanele bakwazi.
Any re-examination?
No, thank you, my lord.
Okay. Thanks, doctor, for your assistance. The one thing I want to put a joke to you. When they asked you a question, you said you're checking and assessing the patient as he's with you when you're filling the form. For my myth, and then you were asked, you said a man can't get pregnant. You remember saying that?
Yes.
Hello?
Yes.
It just caught my ears because I've heard women say, I've got a body trapped in a man's body. Have you heard that? One day you'll appreciate the joke. Okay, can you address what's happening on Monday?
Yes. Please, my lord, I thought we can wrap things up today from the state point of view, my lord. Just a few aspects.
Oh, so we must go to Monday still.
Well, as I indicated, my lord, I've got another party here. I'm not here for the whole of next week, my lord.
So you wanted to wrap something?
Yes.
Now?
Yes.
Now?
Yes.
Okay, let's hear you.
My lord, just three things. Firstly, yesterday there was an issue of the visitors book.
Yes.
Visitors register at Pretoria Moot. The feedback that I've received is that this was just an informal register. They can't trace it. However, they're still looking. So at this point, my lord, they cannot trace it.
Okay.
Then, secondly, there's the issue of the transcripts from the Boksburg Magistrate Court.
Yeah.
We just want to hand up the transcripts. We've marked them Exhibit EE. The charge sheet from Boksburg Magistrate Court is Exhibit E. So the
Exhibit EE.
Yes, EE.
Yeah.
So the transcript of the 27th of October 2020 from Boksburg Magistrate Court is marked Exhibit EE in brackets 1. Then the transcript of the proceedings of the 27th of November 2020 from Boksburg Magistrate Court is marked Exhibit EE in brackets 2.
Okay.
Then the proceedings of the 5th of March 2021 from Boksburg Magistrate Court is marked Exhibit EE in brackets 3.
Okay.
Yes. We have accordingly updated the list of exhibits,
yes, sir,
wherein we are incorporating those the transcripts. Yes. And then lastly, my lord, there is a letter which we have marked Exhibit YY in brackets 1. This is a letter, my lord, from the Legal Practice Council in Gauteng. I've given this letter to my colleagues last year already.
Okay.
Yes. We submit that that letter. It's admissible. It's relevant. If we need to argue this point, we'll do so, my lord, at a later stage.
Okay.
But we beg that it be received as Exhibit YY in brackets 1. I'll place the contents on record. dated the 31st of October 2023. And it's written by a senior legal officer, professional affairs from the Legal Practice Council. And it reads as follows. I hereby confirm that according to the records held by the Legal Practice Council, Advocate Dominic Ntokozo Mjiako was admitted as an attorney by the North Gauteng Provincial Division of the High Court of South Africa on 26 March 2012 and was granted permission by the Legal Practice Council on 6 July 2021 to convert his enrollment as an attorney to that of an advocate practicing without a trust account. Advocate Dominic Ntokozo Mjiako is recorded as an advocate practicing without a trust account, and his legal practitioner number is recorded as 31584.
Okay. Le ncwadi-ke efundwa lapho ngishoshisike incwadi ephuma-ke kwisigungu-ke esiphethe-ke abameli i-date yakhona i-31 October 2023 futhi-ke ibhaliwe-ke uthi-ke ngiyaqinisekisa-ke ukuthi-ke Advocate Dominic Ntokozo Mjiako ngempela-ke ukuhla-ke babameli abavunywa-ke inkantolo noma-ke i-North Gauteng Provincial High Court ngeyi-26 kaMarch ngonyaka ka-2012 wasenikezwa futhi-ke imvume iyona-ke i-LPC ngeyi-6 zikaJulayi 2021 ukuthi-ke angabisaba-ke ummeli noma-ke i-lawyer, kodwa-ke manje abese ekhushulelwa-ke ekuthini abe i-advocate. Futhi-ke u-Advocate Dominic Ntokozo Mjiako futhi-ke ukhona-ke kuhla lama-advocate futhi-ke upractice noma-ke usebenza ngaphandle-ke kwayo i-trust account kanye-ke futhi nenamba yakhe yokuthi abe ummeli ibhaliwe khona laphayana yabhalwa-ke ilowo oyi-senior legal officer.
Thanks. Mr. Komezulu and the other councils, are you going to dispute the information in this letter by the LPC?
My Lord, there's no dispute in relation to, it has been put it clear that the defense does not dispute the status of
okay, fine, no problem.
Mr. Mjiako.
Okay.
Yes. It's only concerned about the relationship between accused number 2 and Mr. Mjiako.
No, you're now going to other things.
Yes.
Me, I'm just asking this letter, are you disputing the veracity of what is stated there? That's all, Mr. Minister.
I make no contest.
Okay.
Not contested, thank you.
Yes, Mr.
No, my lord.
Okay.
Then, lastly, my lords, we've handed various occurrence books and registers from various police stations, exhibit MM, NN, NN1, NN2, PP, QQ, SS, UU, 1 and 2. The originals are here, they are available, my lord. But orderly has just gone to collect them.
Okay.
If it's, we can keep them in our custody and bring them to court every time.
Yeah, you should do that.
Yeah, should they be needed.
Yeah, please.
Futhi-ke ney'ncwadi-ke ezahlukeneke zama-police station ahlukene zikhona-ke lana zizogcinwa-ke umbuso uma ukuthi ziyadingeka-ke zizolethwa khona enkantolo.
Then the state closes its case, my lord, when the trial is ended.
Okay. Umbuso uthi-ke lona ufakazi oqeda ukuphuma lana-ke bekuwufakazi wabo wokugcina-ke kulolu daba-ke oluvelile-ke kulona icala leli.
Okay, so sit on Monday when the defense will decide what to do. Mr. Ngomedu.
Exactly this one, Mr. Mjiako. Our colleague will stand in for me.
Oh, yes, Mr. Banda. Okay, thanks. Mr. General.
Welcome, Mjiako, welcome. Welcome, Mjiako. Welcome, Mjiako.
All right, guys. We'll meet again on Monday. Okay, same time. What a day. What a day. Yo, what a day, guys. What a day. What a day, what a day. Guys, we have seen something interesting there, and not transfer is saying why there was no signature in the confession letter and why he used what? Someone else FFC. I don't know. I don't know what really took place. Suddenly I saying the forms for dentists and medical practitioners are completely different and should never ever be due to different levels of training, qualifications, and code of practice. The dentist was supposed to do at his level of education and practice, but not to go through everything that appears in the form. Many of questions in this form are outside dentist scope of practice. Okay. France, see you Monday. See you Monday, guys. See you Monday. All right, people. I'm now signing out now, but I know that by Monday it will be fireworks on Monday. Let's see who is going to come on Monday, and we'll actually take it up from there. So, guys, see you again on Monday. Thank you for being part of this stream. Adios.